Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning. Yeah. All right, everybody. It's day one of the state of emergency. We know that as of midnight last night, the entire country is being restricted in terms of its movements. And, we're going to be talking about that quite a bit today as a part of our conversation. But it seems, at least with the drive here this morning, that people are paying attention.
Yeah, definitely. I mean, I drove down here from Ladyville, so I've got a pretty good view of what's been going on in the city so far. Definitely, there was no traffic. Definitely not seeing as much people out and about, exercising, walking around. So it seems that, at least so far, people are taking it seriously.
There were no checkpoints. I think the police had said they would move towards doing patrols. I saw some sanitation workers out. I saw some security guards out. There were maybe 2 or 3 cars that I encountered along the way, but it was quiet streets. And it seems that everyone has stayed in their home. And of course, we are happy to hear that. That is a part of our responsibility. And as we told you, we are going to be here with you. We're going to be your eyes, your ears, and help you understand what's happening in the country, and also be able to keep you updated on all things COVID-19 related.
No, absolutely. We, as Marlene said, we are going to be here every morning as usual. And a whole lot is changing nowadays, but at least we're here.
Yeah. So you can expect some normalcy. You'll have your morning show, and you'll also have your nightly news update to be able to feel some sense of normalcy in your routine. And, I think that one of the things that seems to be a recurring theme from people's questions as to when they can go outside, how they can go outside. And yes, it is stipulated in the regulations. And we'll get into that during the course of the show as well. But the issue really is that the purpose is that we don't interact, that we don't move around. This is the purpose behind the state of emergency. It's not just a lockdown for lockdown's sake. So please remember why we're doing this. Up to this morning, on the first day of the state of emergency, we are still with only 3 positive cases of COVID-19, 2 in San Pedro, 1 in Belize City. There were more tests done, and there was also, we've been told that they're still monitoring and people who are in quarantine. So up to this day, we are still at 3. And that's a positive thing. The next 2 weeks, extremely critical because we know that people have been coming into the country. And since the detection of the first cases, we want to see if there's been any spread beyond just those cases who came in.
Yeah, for sure. So definitely it's a situation that we are going to continue to monitor. And of course, you yourself should remain updated, not only in terms of cases, but also in terms of, whatever may be issued by the government or other things which may be relevant to you in terms of how you can move around, your employment, what you can do. So it's important to keep updated in these times because, as I said earlier, a lot is changing day to day. So keeping informed is always important. And I think that, as we were saying earlier, that as far as the restriction of the movement and the state of emergency, people do seem to be listening. And at least as far as Belize City goes, from what we've observed, people are keeping in.
Yeah, that's right. All right, we're going to get into our weather update for today. And of course, our update comes from the National Met Service, and our forecast was put together by Angelia Guy. And the general situation is for warm and dry conditions to prevail over the area.
And for the next 24 hours, what we're expecting is mostly sunny skies today and a clear to a partly cloudy night. We're expecting little to no rainfall, and of course, as a part of the season, we are seeing these seasonable, really warm temperatures persist today, especially over the inland areas.
All right. The temperatures for today, or high temperatures, are going to be 89 degrees Fahrenheit along the coast, 97 degrees Fahrenheit inland, and 83 degrees Fahrenheit in the hills.
And for our lows, we're going to see 78 degrees over the coast, 70 degrees inland, and 66 degrees up in the hills.
All right. In terms of the wind, we're looking at 0 to 50 knots, moving from the east to southeast, which means that the sea state will be slight. There is an advisory this morning that with the very warm temperatures continuing today, especially over inland areas, persons are advised to stay hydrated and seek shade or shelter from under the sun as much as possible. And the outlook?
Yeah. And we are looking for Friday and Friday night. We are going to expect to we're going to expect to continue seeing some warm and dry weather over Friday and Friday night into the weekend.
All right. So in other words, it's another hot day ahead.
Yeah.
And I think the warning is especially important for people who are going to be at home. Just because you won't be out in the sun doesn't mean you won't be impacted by the heat. Do keep hydrated. We know it's been warm days. Not many people will need to be outdoors, but if you do, you want to try to stay out of direct sunlight as much as you can. Inland areas especially. So we're talking about Cayo and Orange Walk. It's going to be very warm. All right, we're going to keep things moving now with our eye opener. Just a little bit of motivation to get us going through the day. And our eye opener is taken from dailyom.com, and it goes like this. Input from experts is valuable, but our own sense of the truth is ultimately the most important. To a certain degree, we rely on other people's accounts of reality to inform us of the nature of the universe. For example, we all can't be molecular physicists, but we can benefit from taking their findings to heart. In the same way, we often look to teachers, various leaders, and gurus to tell us about the path to enlightenment and the nature of the realm of spirit. While this input from experts is undeniably valuable, our own sense of the truth is ultimately the most important piece in processing the information we take in from external sources. In the end, we're the authorities in our own lives, and we have the final say on whether something generally held as true is true to us. This does not mean that we discount the information we receive from outside sources. It simply means that we are vigilant enough to question it before we decide whether or not we agree with it all. All the information we receive is useful in the process of helping us make up our own minds. As we allow ourselves to sit with the things we learn, measuring them alongside our own inner sense of the truth and our own experiences, we find that making up our minds is a joyful process of integration that grows us into stronger, smarter, more engaged human beings.
That's a really interesting message. I really appreciate especially the way it began.
Yeah.
I think that especially nowadays when we have to keep ourselves updated with things day to day, we have to exercise a lot of judgment in filtering the information that we receive. And we really have to monitor what our sources of information are. So when the eye opener began and spoke about the importance of getting knowledge from experts and applying it to your life and everyday situation, I think it's really important. But at the end of the day, as it said, we do have to make the evaluation as to what we're going to keep and what we're going to think. And so, we may get information from various sources and various people presenting themselves to be experts.
Yeah.
But we still have to use our judgment, and a part of it is going to be based on experience, and part of it's going to be based on just that sort of assessment that you make, looking at this person and what are their qualifications or whatever. And then, of course, seeing how you internalize it and how you act on that information.
Yeah.
So that was an interesting thought. I thought that we started off with this morning.
It I'd almost want to say we want to think of this in context of everything except COVID-19, but there are things that you can pull from it, because you're quite right. I think one of the things that we've seen in terms of misinformation is that people just consume the information and assume that everything that they receive is absolutely true. And that's a bad practice in terms of anything. You know, it could be about what diet you're on, to, you know, whether you should sleep, not sleep, so many different things. And I think that what it really talks about is about developing or harnessing your critical thinking skills. And it's being able to get the information and process it, not just get it and assume it to be true. You know, a video in your WhatsApp where someone says, "Hi, I'm a doctor from so-and-so," or "I am a, hi, I'm a some kind of scientist and this is what you need to do," just because they said it doesn't mean it's true. And you know, I think sometimes the old adage is the easiest way to go by. If it sounds too good to be true, it probably is. You know, if warm water would you know, prevent us all from getting the novel coronavirus, we clearly wouldn't be where we are right now. So I think that we just have to take some extra time to filter the information that we receive, ensure that the people that you are trusting as your source of information are getting it from the right sources, ensure that your source is somewhere credible as well, and be able to move into the action part of it as well, because just knowing it is not enough. So if you know you're supposed to wash your hands but you don't wash your hands, there's not much happening there. You got to move into that action phase.
Yeah, for sure. And as you were speaking, what also occurred to me is that when people also receive information, especially in times like this, it's really critical that you evaluate it, because oftentimes we share that information with others, or we tell people that this is how you should do X, Y, and Z based on stuff that you've read or that you've heard, that you saw somewhere. So you don't want to be somebody who's spreading misinformation as well. So that's why it's super important to actually evaluate, you know, the credibility and the reliability of the information that you're relying on, that you're sharing, especially if you have a family. Because, you know, especially if you are a parent, or, you know, somebody who is like one of the heads or the leaders of the household, what your actions do directly affect other people as well. And that's just in your immediate, you know, family, or who are, you know, the closest to you. So you definitely want to be making the right choices when it comes to assessing information, spreading it, and, you know, applying it to your everyday life, because you don't want to rely on, you know, just something that you've heard on WhatsApp and then say, all right, well, I've done everything I need to do to prepare.
Or just read a headline.
Yeah,
you know?
or exactly, like you don't read the article.
Yeah.
So it's important to digest all of that and use it as you use that sort of information to continue to sharpen your critical thinking skills.
You know, and sometimes when I think about it, what we're facing right now in this pandemic, which is a once-in-a-lifetime experience for all of us across the globe, it's almost a perfect storm for misinformation to take root. There is, of course, a lot of people at home with lots of time on their hands. There is a level of fear that people are experiencing because it is unknown, uncharted territory. There is a threat to life because you hear of people losing their life. So it's almost a fight or flight situation that you're trying to find something to do, a loss of control. So you get this information and there's also uncertainty because we are 3-4 months moving into the 4th month since the discovery of the novel virus. And so information is just kind of coming as we go along. And so because you can't tell the whole picture, like how you could Google most of the things in our lifetime, we could have known and predict what's going to happen. This one, we don't have that luxury. So, we're grasping for information, but we just got to be careful because some things, like I said, like drinking warm water may not kill you, but you don't want to have a false sense of security over it. Yeah. But other things like taking medication that has nothing to do with the virus and that is untested and not without enough sound research can actually have an implication on you and can have an implication on others too who really do rely on that medication. So it goes from, little harm or no harm to absolute harm. So you want to think that through. And as you spend the next 30 days at home, and I'm sure you'll be on social media, and I'm sure you'll get lots of stuff in your WhatsApp and Messenger, try to use your filters this time around, right?
For sure.
Okay, but we got to keep things moving for this morning because we got to get into our COVID-19 update. But we got a Thankful Thursday conversation, right?
Yeah, we do.
What's the most inspiring thing you've seen as a result of COVID-19?
Yeah, so for me, it's strange. I think that the most inspiring thing, and it's happened in a lot of different ways, but I think it's really the sense of community that I've watched develop both internationally and also to a great extent here. And it's the way how people have sort of come together in the wake of this, worldwide pandemic. I think that, we've seen the videos of people, in Europe and even in parts of Asia where, they're in the neighborhood, staying inside, but still sort of coming together. They're singing music together, or even the people who are like applauding the frontline workers in healthcare and stuff. That all of that is really moving to me, and I think that it speaks to what really has happened as a result of this is that it's sort of broken on so many barriers because it's something that affects everybody. We've seen people be affected. We've seen from royalty to really,
people all over the globe.
All over the globe. And I think we recognize that it's a threat to just humanity.
Yeah.
And because of that, people have been starting to come together, starting to rely on each other more, ironically in a time of social distancing. But I think that definitely people are more in tune with the just the human experience in general and wanting and relating to each other. At least I think almost everybody in the world has at least one thing in common and something to talk about now. Yeah. So that's been sort of inspiring to see.
Yeah, and I think that there's a lot, and we've got to see other countries and some of the things that they've been doing. I think you named a lot of them. But for me, on a personal level, I really do admire looking at health professionals and the commitment to this. When you choose a career path, as these medical professionals have done, from nurses to doctors to public health officials, you choose to be a part of a process to save lives. And you're seeing people go above and beyond across the globe to be able to save as many lives as possible. And that's such an inspiring thing, because when you have a calling or a purpose in your life and it gets difficult to execute, there are many people who might say, you know what, I would back away, I would call in sick, I would, find many excuses to not do it because it's a threat for me and it's a threat for my family. But we're not seeing that. We're seeing people just rise to the occasion. The battle wounds that you're seeing healthcare workers with bruises and sores on their faces because of wearing masks. And for me, that's such an inspiring thing, because it's following through with your purpose, but in a way that I don't know, that takes so much courage. And I think that's just a very inspiring thing to see. And we see it here. We don't have the kind of battles that we see in terms of what's happening in the hospitals. But we know that public health workers are going out. They've been going out for weeks and weeks. We know that beyond the faces that we see at the podiums, like Dr. Manza giving out information and the rest of his team, that there are lots of other people behind the scenes that have been working and continue to work, preparing us. So I think that's been a part of the inspiring experience as we face the pandemic.
No, absolutely. And as you say that, I think one of the other things that I've also been really inspired by is, both in the context of healthcare professionals and others, is that another thing that we're seeing a lot of is that we're really starting to have a lot more conversations and appreciate healthcare workers and and other workers who are like now in the front lines of these epidemics, because it's people who really do provide the services and goods that are really necessary just for society to function as normal. And as we know, when we're in times of crisis, we have to rely on certain individuals, and those are healthcare professionals, the people who are providing food, the people who are providing medicine, the people who are maintaining the utilities so that our lights can stay on, and that also...
Or grocery store clerks.
Yeah, for sure, exactly. All of these, all sorts of people who don't necessarily always get the spotlight. We're seeing that, and we're seeing more appreciation for them. And I think it's really inspiring, because a lot of conversations are being sparked with which may not have been, or at least not have arisen in the same way. But I have to give them my props too.
Yeah,
because,
no, that's a great reminder. I was thinking, I haven't been to the supermarket in a while, deliberately. Like, I'm trying not to get out there too much. But I remember the last time I stopped in at a supermarket, I just thought to myself, it was busy. And, some people were wearing masks, some people had protective stuff on. And the grocery store clerk was so pleasant. And I'm just thinking, under such pressure, you have people waiting behind me, they were so pleasant. And I think that that's an inspiring thing as well. I'm sure they're exhausted. I'm sure they're worried about their own personal threats, but they're there and they're doing it. So it's a commitment to what we are asked to do. And I think that's also very relevant as we face day 1 of 30 of the state of emergency. They're all doing their part, and so let's do ours as well. Or inspiration can come maybe in 30 days on how well we are able to follow through on the state of emergency. And as we can remind ourselves as the days go by, this is not forever. This is temporary. This is, sometimes when they say toughen up and face something, this is our moment to do that. It may be uncomfortable for a while. It will feel completely out of the norm. But that's okay. This is our part in the fight. We're joining in with the rest of everyone else who's been working to prevent the spread. So there we go.
So
that's
I was just going to say that feel free. We always like it when you participate. So if you're watching on Facebook or otherwise, you kind of tell us through a comment or something what's inspired you. We like to hear your feedback. So tell us what's inspired you during this time.
What's been your most inspiring thing that you've seen as a result of COVID-19? Right. But we got to get moving into our show. And we're starting off with our COVID-19 update for this morning. We're talking about public health and lessons learned from previous pandemics and epidemics. We're actually going to be joined by the former CEO from the Ministry of Health, Dr. Ramon Figueroa, and he's going to be having that conversation with us.
And for our second conversation, we are going to be speaking with representatives from the National Drug Abuse Control Council, and they're going to talk to us about smoking and the effect on your health, especially during in the context of the COVID-19 pandemic and the effects that it can have on your health.
And she was one of the biggest advocates for a shutdown, and she's gotten a chance to take a look at the state of emergency regulations. So she's going to be joining us as the third part of our show to talk about what it's saying, some of the details that we need to understand. So Audrey Matura, attorney at law, is going to be joining us for the third part of our show.
And of course, finally, we have a treat for the kids. As you know, we have a new segment. So we have Kids Time, and we're going to learn all about viruses today, thanks to our friends from J&W Shopping Mart. So that's our show today.
That's right. We're going to go ahead and take a break, and when we come back, it'll be for a COVID-19 update with Dr. Ramon Figueroa. So please stay tuned.
With over 100 years of service excellence in Belize, the Belize Bank Limited recognizes the importance of leading the way as we enter into this fast-growing technological world.
And we are back, and we're jumping right into our first conversation. Of course, we have our COVID-19 update for you, and here to discuss the public health management in the wake of the COVID-19 worldwide pandemic is Dr. Ramon Figueroa, who is the former CEO in the Ministry of Health. Good morning. Thanks for joining us.
Well, good morning, and thanks for inviting me. Just stating that I'm also now the Executive Director for the National Health Insurance. So
That's right.
That's right.
Yeah.
I
Which
won't
is how
speak
you
on
were
behalf of the-
which is how you were allowed to be here this morning, so people can be clear.
Yes.
But Dr. Figueroa, it is an absolutely interesting time, and I think while we are very focused on what's immediately in front of us, there are a lot of lessons to be learned from what has happened in the past. We faced epidemics, and there have been pandemics before as well. What stands out as the most critical fact about COVID-19?
Well, let me start off probably by doing a quick revision of
Yes.
how we got where we are at this point in time. I think everybody already knows that December 31st was the first index case diagnosed. But probably the infection was already there a month or 2 months before.
That's right.
Everybody's still looking at how did it cross over from the animal kingdom to the humans.
Yeah.
Because we're still animals as well. And then 1 month afterwards, January, the WHO already declared this disease a public health emergency of international concern. And then in March 11, declared, again, WHO declaring this pandemic, meaning that basically it had spread to all regions of the world. In the course of 3 months, I think if you sit down and look at it, in the course of 3 months, we are now reaching a level where we have almost over 1 million infected, and probably more, because that's 1 million that have been diagnosed.
Yeah.
You calculate another 25 to 30% or more out there infected. So you're looking at a huge number of people that are infected, with almost 50,000 deaths already in the world. So in a very short period of time, we've had this infection that has traversed the whole globe and has caused a major tidal wave, as I call it, to our health systems across the world. And it doesn't matter whether you are a high-income country or a low-income country, the huge surge and devastation it's causing in the healthcare system is incredible.
Yeah.
Then you look at historically, though, 1918, for example, the Spanish flu, that ended up with about 20 to 30, 40 million, there's estimates of deaths.
And that was an influenza virus.
That was an influenza virus. Then you had the SARS, then you had the swine flu, which was also responsible for 100 to 400,000 deaths. Ebola. Anyway, if you look at and more they're getting frequent, more frequent. It should have sent us a message. And I think if the other day I was listening to Bill Gates, and he's been telling us
For
this
years.
for years. And not only him, but there's been others who have been telling us for years, you need to prepare. That's the next challenge for healthcare systems. And I think hopefully with this, it will shake us up and alert us and make the necessary health system changes that have to be made from a national perspective and from a regional perspective, because I think regionally we also have a big role to play in terms of procurement of supplies. If you start looking at what are some of the challenges in other areas in terms of procurement, on an individual basis, a country is challenged to be able to source things. From a regional perspective, I think there's strength in numbers and it would be so much easier, but we have to prepare for these things.
Now, a pandemic of this size feels like such an anomaly. You know, while we've been seeing some of the other outbreaks and epidemics and eventual pandemics, this is beyond what anyone could have imagined. But there were other countries in the world that had been preparing, at least in terms of planning, to face pandemics. Is that the case?
There are some countries, I guess, some countries in Europe have had started preparing labs had started preparing. I think that's one of the reasons it was so quick in terms of determining the genomic, the diagnosis of the virus and the genomic composition of the virus. But I think there was still a lot more to be done. Look, a lot of other countries, there's a couple of things that influence what's happening. For example, some of the countries are very quick, decisive in making decisions. Extensive planning before it eventually became a huge. Other countries didn't take it that seriously, and so they're the ones that are overwhelmed at this point in time. So there's a lot of critical factors that determine. But I think one of the principal characteristics of this infection is the virus itself. I remember in school when they were, one of our microbiology teachers was telling us, what's the perfect infective agent? The perfect infective agent is one that infects you, doesn't kill you immediately, has a long incubation period, acts as a guerrilla, sort of a guerrilla warfare, has a lot of asymptomatic carriers that spread the virus, and still causes havoc in the human population. This one seems to have all those characteristics.
Fit the criteria.
Fit the criteria.
Yeah.
So while a lot of it, in terms of being a coronavirus like SARS coronavirus 1, it has but it has some additional characteristics that makes it so devastating at this point in time.
And so in terms of our preparation for it, what are some of the specific things that are important that we get right, or we should have gotten right from in preparing for this or the spread of the virus to Belize?
Well, early planning, that's one of the things, but you could look at it in terms of sort of simplistic manner. It's basically public health interventions, the things that we've been talking about for ages.
Yeah.
Infection prevention and control from an individual perspective, hand washing, stop touching your face, basic things that I remember I grew up with. I think we've lost it over time.
Yeah.
And on a collective infection prevention and control in a collective manner as well. So now you're talking with this particular disease, social distancing, isolation, individual responsibility. So the responsibility is really on the population. Yeah. Number one, to take it seriously. Number two, to listen to the guidelines as being and the information being given by the Ministry of Health and the government, and be responsible. The magnitude of the disease and the impact of the disease is totally dependent on the overall population reaction.
Yeah.
There's no treatment.
Yeah.
There's no vaccine. So the healthcare system is, all they can do is prepare for either a massive onslaught or a gradual onslaught.
And that perhaps, I think, is the part of the conversation we don't look at very often. The biggest challenge in this pandemic is that it forces us to recognize that we have to change our behaviors, which is one of the most difficult things to do. We are relying on everybody. It takes everybody to follow through on the procedures, to wash their hands, to keep their social distance, to report symptoms, all of these things. There's an individual responsibility, and that's how we can overcome this. And behavior change is hard.
That's one of the hardest things to do. I mean, we've always talked about behavior change. We spoke about NCDs. Yeah. We know what are the factors, but at the end of the day, it's your responsibility and my responsibility to make a change. It's been difficult to make that change, and now you want to make a sudden change and a quick change. That is
drastic.
And drastic change, and that's why I think the measures taken by government are so important.
Yeah.
Because I think you need to have somebody police and tell you have to do it.
Yes.
I've been telling you to do it. You're not doing it. I need to enforce that, and I think that's what is going to hopefully. Because the other thing is that we are not going to stop this epidemic.
Yes.
We need to be very cognizant of the fact that no country has been able to stop. Remember circulating on Facebook, there was this graph that says you flatten the curve.
Flatten the curve, yeah.
That there's a couple of messages in there. One is that you're not going to stop the wave. What you need to do is modulate that epidemic. to a level that the health services can manage. And you can do that by social distancing and that sort of. But I don't think we'll be able to stop that epidemic unless we discover a vaccine very soon. And all the information we have is that the earliest it's going to be is probably a year, and that I think it's probably going to be more than that. And
It's
by
a
the time we
year for it
access,
to be developed,
developed.
and for us to be able to get it in Belize or
Correct.
in this region
Correct.
is another
It's
length of time.
another, yeah. And the other thing that's important, I think people need to realize that with this epidemic is that the whole world is susceptible. The whole world is vulnerable. You have no previous immunity to this virus, and which is why it's like a wildfire. You light a match in a dry area, it can explode. And that's basically the comparison one needs to understand, that everybody is susceptible. And this is you're going to get it eventually.
Yeah.
And how you end up is also dependent on, obviously, on your immune status. And,
Yeah.
and so.
Can you clarify? I feel that sometimes we see this measure, the state of emergency, which is a critical one to keep us from having a large spike in number of cases. But I also feel that sometimes the message that people have interpreted is that we'll come out of this COVID-19 free. How practical is that thought?
And that's, I think, what I wanted, the point I wanted to make in terms that we can't stop it. Because one of my concerns, in the planning process, I feel that this is going to give us maybe opportune time to continue the preparatory phase.
Okay.
All right? But eventually, we're going to have to relax, or I don't think we can be on a lockdown for 6 months, a year. Eventually, and all the countries around us are going through that infection process.
Yes.
I was listening to somebody the other day saying that the expectation is that over the next 2 to 3 years, at least 80% of the population will be affected by the virus. So it's telling us that eventually we are going to get it. Again, the message is we need to modulate that infection rate so that at the end of the day we don't get overwhelmed, and that we can treat the patients at the hospital level in a proper manner. Because if you get a wave of people coming in, eventually the quality of the service you're providing gets affected.
And we already know we have limited capacity in terms of
Absolutely.
healthcare.
Absolutely.
We had Dr. Quer here who said, stop worrying about ventilators, just stay home, because we're expecting the system to kind of catch up to a pace that we aren't capable of right now.
Yeah, but I still think that we need to pay attention to the ventilator. You see, the lines of intervention, even though I said the control measures are really preventive infection control measures, we have to prepare as well in terms of protecting the health system itself. So we need to ensure that we have the capacity. We need to get the ventilators, and right now there's a huge challenge in terms of sourcing ventilators because the US is sucking up everything that they can get. And we need to have proper PPEs. There's also this debate recently, and I tend to agree with it, that maybe we should start giving masks out to everybody. The advantage, the concern is that if you do that, that they will take
Not
away
enough.
from. But what you want,
Or that people won't use it properly and put themselves more at risk.
well, I don't think there's any
I'll give you
scientific
an
evidence
example.
that
Yesterday
says,
we carried a story in the news. People had the masks
Yes.
under their face
Yes.
and they were hugging people.
Yes, but I think that can be resolved by educating but that is one of the, at least it's being highlighted as one of the interventions that has saved, for example, Hong Kong, Taiwan, and a lot of the Asian countries. They now use masks.
They have a
part-
practice because
have
of
a practice.
pollution. But I want to ask you about that, because I think it's really interesting to see how the information changes as time goes by. You stated it very clearly in the beginning, and I think it's one we have to keep on communicating. We're only 3 months in. The information is kind of coming out as we go along. We're learning from countries as they're in the thick of their crisis and as the crisis starts to wane a bit. And so that's how the information gets to us. When we get mixed messages like, don't use a mask, maybe use a mask. Yes, use a mask. It's hard for people to have confidence in the information that they receive.
No, absolutely, but that's part of also a problem with having social media. Social media to me has two edges to it. I think the sharper edge is on the negative for me.
Yeah.
Because too much wrong information is being sent out,
Yeah.
and it's confusing, and people tend to hold on to things that make them feel better.
Yes.
Yeah, you've seen all these things, articles about what works and what treatment they use and what vitamins they can take, and about drinking hot water that melts the virus. I mean, the amount of information, and that's also one of the things that is important in terms of trying to avoid chaos and confusion in society. There needs to be a trust in the institutions giving out the information, but trust comes with open communication. We need to be very open with the public. And I think the decisive action taken by government and the opposition is an excellent message sending out. This is a time for unity. This is a time that we need to pool our resources together and work together. That's a great message. I think it gives people a little bit more sense of security, that somebody's in charge, that somebody's making decisions, quick decisions. But you're right. I mean, we have to be very careful in sending mixed messages. Today we say something, tomorrow we change. Even though this is a work in progress in terms, because we don't know anything really about the virus itself, and what works and what doesn't work. You know, I mean, CDC's one day they said, all right, don't use face masks. Now they're considering using face masks. They've also advocated for using bandanas with healthcare workers. The point is that I think, and the message I think we need to take is that we need to be innovative sometimes in the way we approach. If we don't have, let's say for example, we don't have N95 masks, the second option is another surgical mask, and the third option is bandana. That's what I'm reading from CDC. You get overwhelmed, you can't just say, all right, I give up. You have to come up with some innovative ways of dealing with the issue. One of the advantages I think we have as a country here is that most of the masks and stuff we procure from outside. Government is the largest purchaser of medical equipment. They can purchase all the N95. I'll take over that and then distribute it to my personnel. But we need to plan. We need to ahead of time. We need to prepare ahead of time. And for us, we require a lot more time because we have to compete with other entities in purchasing these things.
So what I hear from you is that the state of emergency, while it is important to reduce the spread of the virus, because the virus spreads rapidly, reduce the spread of the virus, but at the same time is a critical phase for the planners, that they try to get everything in gear for the cases that will eventually come.
That is correct. I think that's one of the things that we need to consider, not put down our guard and saying, okay, this state of emergency is going to resolve the problem. The state of emergency is going to give us a period of time in which we need to start preparing and ensuring that we have all the training of our personnel. Because remember, the other thing we say, we need to get ventilators. Yeah, but we need to train people on how to use ventilators. We need to have the proper supplies at the hospital for intubation. We need to have the proper guidelines in terms of management of cases. We need to train our people and prepare our people. We need to talk. Look, there's a great fear out there, even in our frontline workers. Nurses have expressed they're in panic. You know, with all the news about the nurses and medical personnel dying from this disease, there's an inherent fear in our, and we need, as the managers and administrators, we need to reach out to them and talk to them and reassure them that we got their back. We will take care of them. We will provide them with all the resources for them to be as protected as they can be, and ensure also that because that's the other thing. They're so overwhelmed sometimes. If they get this massive, they're so overwhelmed that they stressed, overworked, and that puts them also at a high risk because you stress, overwork, poor nutrition, your
Lowered
immune system goes down, and then you're at the front line, you become a high risk. And there are some people, frontline people, who are also diabetics. So we need to do that proper human resource planning as well.
Yeah.
And not and remember that we have all the regions and the districts as well. So it's not only Belize City. We need to reach out to all the other areas. And I think there probably we have not been as effective as we need to be, because there's still a lot of fear outside.
Yeah.
I think the statement made by PM that, listen, we're going to provide you with enough financing for if you need babysitters, for a place to where you can isolate, where you can change. But I think at the local level there needs to be also that reassurance, and I still feel that we're lacking that. So that's the communication internally with our frontline soldiers, so to speak.
So
There's
that-
also that communication with the public,
Yeah.
which is also a major challenge.
Yeah.
And I was going to also ask, in terms of planning and management looking forward and after the initial 30-day state of emergency, maybe you could describe what you would consider to be the best case scenario in terms of our management of, let's say if we do the preventative measures and we keep flatten the curve, or, we don't have much of a curve yet. But, what would be the best case scenario in your view, and how we could possibly manage this because we, going back to you say, we can't prevent it from coming, we can't prevent it from spreading completely, but what would you think be the best case scenario?
Well, hopefully if we're able to explain to the population and convince and continue the education process during this period, and where people start changing more their habits, I think the infection rate and dissemination will be less marked. So eventually you will be able to, as you get the cases, you will be able to manage that. Hopefully the hospitals are better prepared. You will get maybe a couple of cases that they can be managed properly, but you have the equipment that they can be managed and not cause internal hospital infection as well, because you don't want to convert hospitals as a source of infection afterwards. So that I see, you will have cases, but we will be better prepared. The number of cases should be less. The spread of infection hopefully would be less if we continue, but we need to, this month, we need to ramp up the messaging, the outreach to population. Because if we say just isolation and quarantine, we don't continue to message people and try to convince
About
people
washing your hands,
about washing their
not
hands,
touching
about
your
being
face,
right,
proper cough etiquette.
correct.
Yeah.
That at the end of the day, we'll be right where we started at the beginning. So those are things that I think we need to keep in mind.
And I think that part of that messaging is explaining to people just how sneaky and evil this virus is. And I wanted to get your expertise on this. So it is more contagious than a flu. That's what the data seems to be saying right now. It is more severe for those who develop the symptoms. But also what seems to be the recent data, and I think it prompted the CDC now considering having people wear masks, is that they have now gotten sufficient data to say that a large number of people are walking around perfectly fine with COVID-19. Like, I could have gotten it last week and I could be here every single day with not a single symptom and be passing it on to everyone.
That is correct. I mean, I think they've even thrown figures of 25% of the population walking around asymptomatic, but still what they call them super spreaders. They're spreading the virus. So every individual needs to be able to understand that and not only rely on whether they have symptoms or not to observe the infection control measures. It has to be part. We said it's going to change life. We need to incorporate some of these new practices in our daily lives. we spoke. I don't like that issue that we can't hug anymore, but it for a while it has to be some of the things that we incorporate.
Yeah.
You know, and I think the other thing that I think we need to do right now, which I forget, and I think is important, is that we need to reach out to the private sector as well. I feel that sometimes, and I'll talk my time when we tend to plan and think that health is only the Ministry of Health. We have a lot of other stakeholders out there that are waiting and willing to help. For example, with the National Health Insurance that we have contracts with clinics, they're waiting, they're willing to help, they're willing to assist. We just need to reach out.
Yeah.
And so we've been able to do that, and I think they're providing quite significant support to the central region. The same thing with other regions. So, but we need to reach out.
Yeah.
You know,
So
that's important.
Let's talk about that a bit. Just how the NHI system is working in parallel with the Ministry of Health system, because you have clinics, we know in Belize City especially, and you do kind of primary health. So it's one of the frontline spaces that we have.
I'm correct. It's not parallel.
Well, I'm asking, is it parallel?
No, it is part of the health system, and that's, I think, one of the misconceptions that we've had over time. It creates a bit of a problem.
Yes.
That we think NHI is separate from. It's part of the health system. It's part of the network it's a primary care network that exists there to help the Ministry of Health. So we just recently sent out, because some of the people think also that, oh, I belong to NHI, I don't have to work with. No, this is a type of national emergency. You are now subjugated to the rules and guidelines of the Ministry of Health, and you need to be part of the resources of the Ministry of Health. So what we've tried to do, and in Belize City we have private providers. As I said, we've reached out to them, we've sat down.
So you have the Mercy Clinic over here that works with elderly from the entire district.
Yes, it involves from the entire, we have, I think, people even from outside of the district, but
and you have how many in Belize City?
5 clinics.
Okay, tell us all of them that are
Belize
NHI.
Medical Associates, Belize Healthcare Partners, BFLA, Matron Roberts, and Mercy Clinic.
Okay.
But Mercy is, we've tried to pay special attention to Mercy because they're a high-risk population.
Yes.
So we're setting up, trying to avoid people coming in. We're reaching out to try to give out all their chronic medication, because most of them have chronic medications, a 2-month supply, so that they don't have to come in. And the same thing the other clinics are doing now. So we've highlighted who are those who are hypertensive and diabetics. We've tried to use technology through the Zoom to reach out to them, explain the importance of them being isolated. If anybody in their household has a cough and cold, you are high risk. You need to find a way. What are the criteria for isolation? Send and get your medication. Get a 2-month supply, so you don't have to come to the clinic. And we've helped some of the clinics also establish guidelines how you deal with the outpatient. So now we're separating those with respiratory infections versus all the others, and we've worked together with all the clinics, and all the clinics are part of that. They've also coordinated with the regional management of Central Region to also offer. They're willing to come in and take on the excess load as they converted Cleopatra White to a respiratory center.
Yes.
They're willing to take the excess load of all the other cases, because we can't forget that there are still other needs in society.
Absolutely.
We can't just close down and say, you know what, we only have to deal with COVID-19. There's other people who have needs.
So yesterday, Central Health Region sent out a release talking about new procedures, and it's talking about what to do when you have flu-like symptoms. So that's critical information as well. So what they're telling people is stay home, still stay home.
Stay home.
Even with flu-like symptoms, and call first.
Right. And so that information has been shared with all the clinics.
Yeah.
We had a Zoom session yesterday to talk to Doctora to see what are the updated guidelines so that everybody has it. There's been also telephone numbers circulated for each clinic, so that if you belong to that particular clinic, you can call that clinic. And then they'll do an online screening and send you to the proper referral center. So we're finally
Is that so that a person who may potentially have COVID not go to a clinic and expose others who may be there for prenatal checkups or, you know,
Well,
whatever other
yes,
issue they're dealing
that
with.
is the whole idea.
Yeah.
But we've also separated at the clinic where you have anybody else who comes for any other
Okay.
consultation is seen by a separate staff in a separate area. Those who come for cough and cold is in a separate line, a separate staff with all the proper
Okay.
procedures. So we've standardized that and circulated across
Okay.
so that everybody has that. Also remember that one of the things that we need to consider when we say somebody has suspected and they need to come in and swab, we have to consider the whole process of risk as a person moves around, because not everybody have a vehicle.
Mm-hmm.
And so we have to be very
They
careful.
may come on a bus or
They
in a
come-
taxi.
Correct, correct. So those are things that are part of the planning process that I think we need to pay attention to. One of the things that we've done with through the National Health Insurance is we call them the COVID packs. So no, it includes Tylenol, cough medicine, and antihistamine. Put them in packs for a week
Okay.
treatment, so that people have cough and cold and you could stay home. Send somebody to pick the package. You don't have to come to the health center. We'll get it to you, so that you treat yourself at home. You have the medication. You don't have to come to the facility.
Okay.
The idea is you have right now, you treat anybody who have cough and cold as a potential. Stay home. Stay home unless you have a severe case or medical case. Then call and get some guidelines as to where you can go.
So when you're filtering out these cases, how do you decide who's going to be tested?
Well, that's a Minister of Health guideline. I believe that up to yesterday, we had a discussion yesterday on that. If you're symptomatic and you meet the case definition, you've traveled abroad coming from a place where there has community transmission, and you're symptomatic, that's probably one of the primary criteria for you to be tested. But we're
So we're still
discussing-
relying on a travel history?
Yes, and contact with anybody.
Or
who,
contact with someone who's
with somebody
traveled as
who's
well?
traveled.
Okay.
Yeah.
Yeah.
So
Do you feel that we're testing enough?
No, I don't think so. But that's not because we don't want to test. I think. Remember, we're limited also by the number of tests that we can. So we have to be very judicious in the way
Yeah.
we do testing. I wish we could do more testing. I think everybody agrees that we should do more testing, but we don't have all the number. So we need to be very judicious and use it.
So let me ask you about that. So, you know, we hear 2,000, 3,000 tests that will or most likely will come. Sometimes when we hear numbers like that, we think that's a lot. That's enough to just do mass testing to anyone who has flu-like symptoms.
I don't think.
How do you, I mean, is that an accurate way of thinking?
I don't think that's still enough. I think what it will do is it will allow us to do a bit more, because there's guidelines and criteria. What is priority number 1, number 2, number 3,
Yeah.
and so you move down the priority list depending on the number of resources and testing kits that you have.
Yeah.
So
But your whole issue is that it has to be sustainable, because it's not just a month that we're looking
Right,
at. We're
right.
looking at the next few months.
Correct.
That we
Correct.
have to have tests
correct.
available.
So we need to plan how we're going to use this supply
Yeah.
over time.
It's like when you have a tight budget and you have to pinch
Correct.
pennies until you get there.
Correct.
In being able to help the public, everybody's at home this morning. It's the beginning of a very strange experience for all of us. How can you help us understand what we can expect from what we've seen in other parts of the world, from the actions that have been taken? What can you say to people about what type of expectations to have?
I probably would say look, as we were saying, we need to still hammer out the information about hygiene, infection prevention and control, and make it clear to people, that what's happening, what you're seeing out because now you're going to stay home and watch TV and you watch all the news from what you're seeing out there.
Yeah.
Can happen here if we don't take more precautions and start adopting some of these preventive measures. That doesn't mean that at the end of this period we will not have additional cases, but we can reduce the impact and avoid what's happening in some of these countries, what you're seeing on TV in some of the emergency rooms and intensive care units. We can avoid that by us being responsible in the way we. And this month is a critical. I think we need to hammer. For me, education.
Why do they keep saying that? Why is
this?
this month so critical?
Because we have a right now we literally frozen the country to say, all right, we're not going to move around and spread the infection, hopefully. So this is a point where we expect that the transmission and the infection spread is going to be either stopped or we hopefully we don't have local transmission, and so we prevent anybody from coming in and at this point in time. So that gives us a space of time. After that, you will go back to
Moving
around. And if we don't modify our behavior at that point in time, we go back to where we were before again, where we have that massive, we can have that massive infection again. So I think we could use this as an opportunity. Telling them, you see what you see on TV, you're just as responsible to prevent that, but you need to adopt hand washing, stop the circulate around the place, like as I heard the attorney just said, stop the buffoon around the place. But those things, I think, even afterwards, we will have to look at mass groupings as something that we would probably not want to do even after this month period, and probably go slowly into try to go back to normal in a gradual phase. I think that's what I would think.
Wow. And looking at lessons learned, so China is the furthest ahead because they started. I know now there are recent concerns about how much they reported cases, but we now see them looking at reinforcing restrictions as to who come into the country, that they've had people import cases again. What does that say to us for our future?
Well, for one, I think, for example, one of the things that's important for us to learn is that we need to ensure that our health systems are up to par. We need to invest more in our health systems, in the capacity to react, in the capacity to plan. I think one of our advantages in Belize is that we have quite a strong primary care system. It's important. We need to invest more. There's actually, now that you say it, in 2006 or somewhere thereabouts, 3 or 7, there was a joint external evaluation of our international health regulation capacity in country. That's important because it gives you a framework of what sort of investments need to be made in the country in terms of being prepared for epidemics. And there's a lot of areas that we failed.
Yeah.
We need to focus back on that and see how we can strengthen that capacity.
Yeah.
Invest in more in public health capacity, lab capacity, surveillance capacity. From a regional perspective, I was saying I think we need to start looking at better surveillance systems, procurement, quick procurement. If there's one thing that this taught us is that we should have the capacity in the region to either convert private sector into manufacturing.
Yeah.
So those are things that we probably need to look at and learn, and do a lot more. We need to do a lot more. Pay attention to climate and climate. This is part of the climate change, and as well, we're encroaching into the animal kingdom. The population is expanding, more interaction between humans and animals, and that is part of the reason we're having these crossover infections, and it's not going to stop. So those are things that we have to look at as well. So those are significant, I think, policy decisions that need to be made, not only from a national perspective, from a regional perspective as well. And so I would say after this, we need to sit down as the region and say, all right, how can we now better prepare for something that will eventually come down again? Because it's going to come again.
Okay, that's a very sobering thought to close off with as we try to get through this one. But I think the reassuring point is that we actually have more control than we think. If we keep our distance, if we wash our hands religiously, not touch our faces, that's the hard part for me. I am guilty if you catch me on camera. But just recognizing that for this period of time, we have our part to play. And it requires a lot of actions and commitment to follow through on those actions at home and for yourself.
Absolutely.
Thank you for coming in, Dr. Figueroa.
Thank you for having me.
All right, we're going to go ahead and take a break, and we'll be back in a few.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the
And we're back, and we're moving into our second conversation for this morning. We are talking about some of the high-risk behaviors associated so far with COVID-19. Dr. Figueroa was very clear in telling us, remember, there's certain things that we're just not sure of as yet. But we are joined at this time by the Director of the National Drug Abuse Control Council, Esner Veas, to talk about these high-risk behaviors. Good morning.
Good morning, Marlene. Good morning, Gavin.
Yeah.
Good morning, Belize.
Yeah.
And we're here to speak about the effects that smoking and alcohol consumption has on COVID-19, right?
Yeah.
And these are things that we, throughout the work of the National Drug Abuse Control Council, we have been emphasizing the general public to reduce consumption of tobacco, to reduce consumption of alcohol. And in this point in time, it's when we really have to make sure that we take this into consideration, because as you can see, the literature has been saying that the effect that alcohol has on and tobacco have on COVID-19 is very alarming.
Esner, we know one thing, and I'm saying it anecdotally and not based on scientific research. We as Belizeans, we drink very often. We drink socially, we drink when we're bored, we drink when we're celebrating, we drink when we're mourning. We drink because it's Thursday or Friday or Saturday or Sunday. We drink because we're home, because there's nothing else to do. And so I would venture to say that a lot of people right now in the state of emergency, they may not be drinking to get drunk, but just to be able to even settle themselves during the day.
And
So we're talking about a behavior that I'm sure people are just saying, what do you mean I can't drink right now? What do you say to them about how it impacts their risks?
Again, drinking alcohol in general undermines your immune system. It weakens your immune system, right? And imagine you having a weakened immune system and you contract COVID-19. And you know that once you contract the virus, there isn't any medication that will be able for you to assist your body to be able to fight the virus. And with a weakened immune system, then it compromises your body and your health even more. And that also happens with smoking tobacco, because we all know that these substances, for example, in the case of tobacco, it compromises your respiratory system.
Absolutely.
And we know that COVID-19, the first thing that it affects is your respiratory system. And whenever you're smoking, you have pulmonary disease, you have pneumonia, and these other diseases that affect your body. And if you catch the virus, then the probability that you would need a ventilator is very high. So that is why the National Drug Abuse Control Council is sending the call out to the general population that at this present time that we are very careful in terms of consuming alcohol and consuming tobacco. We have 30 days that we have been given. In these 30 days, our concern is to make sure that the general public changes their lifestyle. Because, and this is one of the things that is being talked about a lot during this period, right? Changing our lifestyle, eating healthy, making sure that we wash our hands, maintain social distancing, but also include in all these preventative measures the reduction of the consumption of tobacco and the reduction of the consumption of alcohol.
From the data that you do have, what's the situation when it comes to people who smoke and also people who drink excessively in Belize?
Well, we have to look at it in two ways, right?
Okay.
The effect that it has on your body,
Yeah.
but also in terms of the effect that it will have that you would transmit the virus.
Okay.
For example, if you're smoking tobacco, the mere fact that you're taking a cigarette in your hands and putting it in your mouth, it's one of the reasons
That's
why.
your touch your face.
That's your touch your
you're
face.
right.
You're touching an object that can potentially have the virus. Now, factor into that cigarette that you've touched is also shared by someone else. Then that means that
Like if it's marijuana,
Marijuana.
like if we're sharing
Exactly,
marijuana.
or you're sharing hookah or you're sharing e-cigars, then the probability of you contracting the virus is high, but at the same time of you sharing the virus or transmitting the virus to another person is also very high. So that's the reason why we at the National Drug Abuse Control Council have joined the work that is being done by the Ministry of Health to make sure that we can also contribute to the reduction of the transmission of the virus through these substances, right?
Yeah.
Now, when you're looking also at alcohol, you open a bottle of beer,
Yeah.
you throw it in a cup, you drink a sip, you share that cup with someone else. Again, that's another avenue of transmission.
Yeah.
Or even if you're sharing a bottle of rum or a bottle of wine.
Everybody touches it.
Everybody touches it.
Yeah.
So we have to really be cognizant of the fact that there's two ways that we can be impacted by the virus when it comes to tobacco consumption and alcohol
So
consumption.
we're not even talking about how we use it. We're talking about the fact that we may be socially distanced, but
yeah.
we're touching the same object in between.
Exactly.
Whether it's the bottle of wine, rum, marijuana, or whatever else that we're sharing.
And also, let us dispel the
didn't think of that.
myth that alcohol cures the virus or kills the virus. It is not so. The
Yeah.
consumption of alcohol has no effect on on the virus itself. But if you use alcohol to wash your hands or to clean your hands or something like that, then it might work, right? But in terms of consuming the alcohol, that's a myth. It doesn't work.
And you know, to kind of piggyback off of Marlene's earlier question, do we have sort of an idea in terms of like numbers of persons who are like actually at risk in term, and I mean people who are like maybe chronic users of alcohol and tobacco? Do we have an idea, at least in the country, of how much like the size population that we're looking at?
Based on our statistics at the National Drug Abuse Control Council, we see approximately 400 clients on an annual basis. Of that 400 persons, about 50% are chronic users of marijuana. Then it is followed by consumers of alcohol. So we have a very large population who consumes marijuana, who consumes alcohol, and also followed by the consumption of tobacco, right? And this conversation that we're having is conversations that we've been having for quite a while. But this is the time for us to reinforce the message that the National Drug Abuse Control Council has been giving out so that the general public can understand the level of risk that they have when it comes to the consumption of these substances.
So in the United States, they were seeing a lot of hospitalization in younger populations. And one of the things that they are saying, maybe, because we still don't have all the research, it could be the vaping that the younger population is doing.
Yes.
There's no guaranteed link here. That's just one of the things they're looking at. So you're not just talking about traditional cigarettes or marijuana. You're talking about some of the newer technologies as well.
Like windpipes, hookahs,
E-cigarettes.
But even though there isn't scientific evidence that there is an effect on it, it's better to err on the side of caution, right? Because we're in a country where we have limited ventilators, right? And we have to make sure that we, as citizens of this nation, we can also take heed of making sure that we are doing our part to make sure that we don't have to use that ventilator in the event that we have the virus, right? So I want to make sure that I emphasize, especially for young people, this is the right time. This is the time for you to make a change in your lifestyle. And to make sure that you don't only reduce your consumption of smoking of cigarettes, but also in terms of smoking non-traditional substances and also that of alcohol.
So we do, I think that the link is easier to draw with smoking and tobacco products because people know. I think there's like general knowledge. It's bad for your health. It affects your lungs. So even if you don't link it, if you're doing something that's going to make your lungs weaker or not as strong, and you have to fight off a disease that will primarily affect your lungs, that's definitely putting you in bad shape. So I think that even if there is no link, there's always a proper excuse to not encourage that type of behavior. But we don't see that with alcohol. I think people don't think of how alcohol may actually affect your immune system and your internal organs.
Yeah, in many ways it does. I mean, first we have to understand that alcohol inhibits your immune system. We have to part from that era, right? But at the same time, when you consume alcohol, you're also minimizing the function of your liver, of your kidney, of your cardiovascular system, right? So all of that, when you're compromised with the virus, the probability of your body to be able to fight the virus increases drastically, right? So we have to make sure that we do the parallels when it comes to alcohol consumption, right? But added to that, it's 30 days that people will be at their house, for example, right?
Yeah.
And it's 30 days where people, and we're at this present time having a lot of uncertainties, right? A lot of anxiety is building up, and a lot of depression is also there, because there are a lot of people who don't know where they will find the next meal because they have lost their jobs. And most of them will search for alcohol to solve, quote unquote, the problems that they have.
Yeah.
But then that brings in another layer to the whole issue of how alcohol affects COVID-19 in terms of the increase of domestic violence, the increase of, in terms of how an individual who is at home consuming alcohol will have that effect on the kids, right? So we have to make sure that when we're talking about alcohol and the effect it has on COVID-19, we don't only look at the health aspect of it, but also in terms of the social aspect.
Yeah.
And I also wanted to ask, you know, in the case of both alcohol and tobacco and other substances people smoke, a lot of the times these are chronic habits, and in many cases, you know, people have been doing it for years, and it's going to be very difficult for them to make that break in these circumstances. But I'm wondering if you have any sort of advice for those persons who might be listening to, you know, are saying, all right, well, they recognize that, you know, the disease can have this effect, but, you know, I've been smoking for 10, 20 years. So do you have any advice for somebody like that? What can they do, or if there's any resources they can access?
Well, one, the government has given us 30 days to really sit down and think, not only in terms of changing our lifestyle in terms of consumption and alcohol, but changing our overall lifestyle in terms of health management, right? Two, they can access services that we provide at the National Drug Abuse Control Council. Right now what we're doing is tele outreach, meaning that they can call our offices, and through our outreach case workers, they will be able to advise them in terms of what to do, what not to do, where to go in terms of seeking help.
Yeah. What other advice are you offering to people? I know you know that the challenge of breaking some of these behaviors that we just don't think, like the consequences of things like alcohol consumption and even smoking, it's not immediate. It's it's like when you have liver failure or you have damaged lungs, it's way when it's too late. So how do you get people to understand how in the context of COVID-19, it's an opportune time?
It is an opportune time, because this is where you would realize that that you do not have the virus, you do not contract the virus. The opportunity to be able to change that mindset that you have, right? We live in a society where alcohol is very much present in our daily lives, as Marlene had said earlier, right? But we need to be conscious that whether COVID existed or didn't exist, the effect that alcohol and tobacco or any other substance have in our day-to-day life and on our health is very big, right? In terms of if you compromise your health system, right? The amount that it will take, or the financial implications that it will have for you to be able to cover the expenses to take care of something that you could have merely avoided from the onset if you would have reduced the consumption of tobacco and alcohol, right?
Now, how do people get in touch with you? Where are your offices?
Well, one, you can call the MOH hotline, 0800 MOH Care, where they will be able to channel you wherever you need to go. And we also have a specific assigned number right now at the National Drug Abuse Control Council, which is the 227-1121 number. Once you call that number and you request any type of assistance, then the person that is answering the phone will be able to channel you to our different district offices, where our outreach experts will be able to guide you and to assist you in whatever needs you may require. We're also working very closely with the rehabilitation facilities, where individuals will be able to go and make sure that they will be able to get the services that they require. And also, if you are not able, because of the distance that you might have in terms of reaching out to a National Drug Abuse Control Office, you can always go to your nearest medical health facility where there will be a psychiatric nurse practitioner that will be able to also guide you during this time of need.
You know, these types of habits are considered coping mechanisms, unhealthy coping
Yes.
mechanisms. And in a time where things are just so out of sorts, it's really hard for people to just imagine that you're saying, you know, stop completely. Is it a matter of perhaps weaning off? Is there an I mean, people may be saying, well, I want to have a beer here or there. Is it that is it that you shouldn't, or it's how often and how much?
Well, we have to realize that stopping an addiction is not an overnight thing.
Thank you. Yeah.
Right? It takes its time. But
Yeah.
more than time, it also takes willingness on your part to want to make the change, right? So what we're advising the public that does consume any type of substances, because today we're only talking about tobacco and alcohol, but there are other substances that also compromises your immune system that would contribute to a higher level that COVID might affect your body. Stopping the consumption, like I said, requires a lot of will, right? But when there's a will, there's always a way. And when you want to change your lifestyle, you always find help, right? And that is where the National Drug Abuse Control Council and all the other agencies within the country of Belize are here to provide that service to you.
So if someone wants to take a beer for the weekend, just one on the weekends, that's fine?
That's fine, but once you do not abuse. You see, that's the whole thing when it comes to substance abuse or the myth that there is behind the consumption of alcohol or the consumption of tobacco, right? That people do not know when to stop. And that's the key thing here. You need to know what are your limits, and you need to know when you are already in a position where you are inhibiting not only your physical ability to be able to do things the right way, but also how that affects your loved ones, affects a community, and all that.
Just one night a week binge drinking is a problematic behavior.
And the message that the National Drug Abuse Control Council is sending is that it is our hope that people stop smoking, and it is our hope that people stop consuming alcohol. But we know that doesn't happen overnight. But what we're saying is that because of COVID-19 and the effect that it has on tobacco consumers and alcohol consumers, reduce the number of cigarettes that you're smoking, reduce the number of weed that you might be smoking, or alcohol.
Or frequency too.
And the frequency, so that in the case that you do get the virus, that the probability of you needing that ventilator is lower.
Okay. Yeah. Well, any final advice to people? If somebody watches and says, "Okay, fine, this is the time." You said support over the phone.
Yes.
There are rehabilitation programs in the country
there are rehabilitation
for alcohol and
alcohol
drugs.
use. Yes. And also we have the psychiatric nurses countrywide that will be also be in a position to provide that help to everybody. This is the time, and this is the message that the National Drug Abuse Control Council wants to make heed of, right? Apart from the social distancing that the Ministry of Health is asking for us to do, the constant washing of hands, the changing of lifestyle, reducing the consumption of tobacco, reducing the consumption of alcohol, eating healthy, but also taking care of our mental health at this present time.
All right. Well, thank you for coming in, Esna. We appreciate it, and it's a great reminder that if we want to have our immune system in optimum shape, we also have to look at the bad behaviors and bad practices we have as well.
Exactly.
Thank you. We're going to go ahead and take a break, and when we come back, we'll be looking at the state of emergency regulations with attorney Audrey Matura. Stay tuned.
With over
And we're back. And we're back. And we're getting ready to start our conversation for this morning with attorney Audrey Matura. I gotta say, she's been one of the biggest advocates or most vocal advocates for what people call a shutdown, but what we're calling the state of emergency here in Belize.
Exactly.
Good morning, Audrey.
Good morning.
Good morning. Thank you for having me.
Yes.
I know I have limited time, so I don't know what all you all want to ask about, but I want to start by saying
Go ahead.
something. Yes, I've been one of the vocal advocates,
Yes.
and I know by doing my live FB shows, I would say 99% of the people who came on were for it. I had a viewing of over like almost 50,000 people came on to view what I had to say and explain legally what's a state of emergency. I want people to know that the reason I wanted a state of emergency was because under a state of emergency, the government then takes control and is able to do take certain measures. But it's not just measures that you give up certain rights or you take control as to who can or can't be on the streets or not. Because it means also that the government then cannot only take away these rights from you, but the measures of relief they must also take is for them to be able to make sure that the people who will suffer the most are taken care of.
Yeah.
So based on what I've heard so far, I mean, it's not that I want to be critical, but it's a start. It's a good
Yes.
start. But there's a lot of things to be ironed out, and I hope they do, and that they're not arrogant, that when they hear very good criticism, logical criticism, practical criticism, they say, oh yes, we can make those changes. The way I'm seeing it is that clearly this will be a phased in or phased out state of emergency, in that what I'm thinking is that, to me, they started too wide a base of who could be out there. So there's two ways you can do it, in my opinion. You start with a wide base, and as the situation changes, you go narrowing it down, because at some point it should only be food and medicine. Right now it's food, medicine, construction, Bolido, and that kind of thing.
Well,
although I hear Bolido
and I'm
has
glad
been
that
corrected.
you gave me the opportunity here. We do have a latest update. We have confirmed with the Commissioner of Police that, in fact, Bolido will not be considered an essential need that you can use as an excuse to go out
Exactly.
and purchase. It was very, I think people misinterpreted my line of questioning yesterday when I was asking about tacos vendors versus Bolido. It's not that I think that we should have people on the street selling food. It's just how we prioritize things.
Yes.
And so I think it was a major concern. Up to yesterday, it was being said that people would have been allowed. I believe the Attorney General explained it in one show, that if the grocery store offers it and people are going to be at the grocery store, they can still purchase it. But it still was concerning, especially seeing what we saw in San Pedro with lines for people going out for Bolido.
It doesn't make sense.
But as I said, this morning, in fact, just a few minutes ago, we got confirmation from the Commissioner of Police that you will not be allowed. It'll be suspended during the state of emergency.
Yes, and so the other way I think it could have been done is that you start very stringent, and as the situation gets better, you start loosening and say, okay, these ones can. But I will applaud the government to at least take the step, because they were saying they were going to wait until community transmission. Community transmission means that so many people in the population has it, they're transmitting it to each other. That didn't make sense to me. I believe, my view is that they have missed 4 opportunities to do it the right way. The first opportunity was the minute you knew our neighbors had it, you had to shut down the border. They took long to shut down the border. The second opportunity was that when they finally shut down the border, they had the opportunity to quickly say, quarantine everybody coming in. We got to make sure that it's not imported in. And if it is, we contain it immediately. Patient zero is the perfect example where we failed to do that. Then there was a third opportunity to get it right, which I say, the minute we knew we had one patient, we should have shut down then, so that we don't wait until it spreads. Luckily, we haven't had the spread other countries have had. So that was the third opportunity. This is the fourth one. And I put this one as the fourth one because although I say it's good that they have had the foresight to finally call a state of emergency, they can't be so lax. But I will give them a slack simply because the truth is it's something new. And I'm hoping they have a lot of heads together, and as we work it out, the commissioner who will be on the ground with his people need to give good feedback, and the authorities then need to say, commissioner needs to say, well, AG or Prime Minister, these things are not working for these reasons. This is where we are having problem. and we tweak it as we go along. I'm hoping that's the level of maturity we'll be having. I don't know everything, but from my lens and my little perch, I will say what I think can be improved, and I hope they don't take it in a bad light.
Yeah, so that was going to actually be my first question, because now that we are in the situation where the state of emergency has been declared and the regulations have been passed, what is kind of your reaction when you read on a reading of the legislation? What was your reaction? Do you think that it goes too far? Do you think it doesn't go far enough? What's your initial view?
I found a lot of contradiction, but one was corrected already, because, for example, like Section 5 says that you can go out to purchase essential needs. You can go to attend medical and veterinary attention, emergencies, all the essential workers and so. But Bolido would not have fit in that, not to over talk about the Bolido situation. So you have to look at what the principles were. The principles that I get from this SI is that the purpose of preventing, controlling, containing, and suppressing the spread. How do you prevent, control, contain, and suppress the spread? By limiting movement. And so I think right now the movement allowed is too wide, because now I'll go to Section 8. And Section 8 right here says, again, for the purpose of preventing, controlling, containing, and suppressing the spread, what are you able to do? They put periods of time when you're able to open. Between 5 a.m. and 7 p.m., you could have gas stations, fuel depots, LPG suppliers. That makes sense. We run on fuel. And those entities now have to put in measures that will protect their employees. And it doesn't mean that they abuse the employees, and it doesn't mean that they have to have full-blown staff, because they still have to practice social distancing. So this is when I would recommend to employers of that nature, have a rotation process. So if you had 20 staff, instead of them all 20 being there for 8 hours or 10 hours, divide them 5 so much hours, 5 the other hours, 5, and continue like that.
So the chamber has been offering some information along those lines. That they're calling it the business continuity planning, in allowing for businesses to keep on going and looking at how to manage the staff over the course of the pandemic. And that's one of the suggestions. But before we get to all of that, one of the things I wanted to look at was a state of emergency is something that is new to us. We've only seen it in terms of when they have taken up people who've been associated with gangs. That's perhaps the most recent example. We saw in San Pedro, sometimes after a natural disaster, there may be a state of emergency. People are accustomed to hearing of things like martial law. So we hear that, but this is really interesting, because there is what is the typical classification of essential workers, and then the extension of, or the inclusion of people who were non-essential before, but now essential for this pandemic.
They're very wisely, they put it differently, because if you look at what they did, they created a category essential. When you go to the schedule, it said essential. And then they said the government departments would be open, but somewhere in between Section 8 and 9, they said these can be open. So they didn't call them essential. But in the mind of the average person, only essential services should be out. So that I would say they're not essential, but because they're allowed to be open, they are viewed as essential. Because under essential, we actually have an essential act, Essential Services Act. And if you look at it, many of these would not qualify. So I could understand why you would do that, because you want some semblance of the economy and the country keep rolling. You don't want a full halt. I could understand that. But I still think there are areas to be tweaked, because I was going through the list, right? Public transportation providers, I still think that the quarantine legislation that says only 10 people, but yet the bus can carry the full capacity, is contradictory. It sends mixed messages, and then it goes against the premise of what you wanted to say, because the premise, as I understand it, is social distancing, small gatherings. So you can't with one hand say, this is 10 people here, we can only have 10 people in the studio, but when I go on the bus, I'm sitting next to everybody else. It's contradictory, and it goes against what you want to do to be able to get remedies. Then you have bakeries and tortilla factories. I expect those to be open, because those are not essential services in the strict sense of the law. But these are necessities. So I would have said necessary services or necessities, right? Agriculture and aquaculture, I could see why that is being left open. Those industries then have to tweak it and put whatever they need to protect their people. Fishers, clearly the fishers would already licensed one. People said, careful when you say fishers, be sure you say license. I said, but it's understood. If you don't have a license, you can't be a fisher. It's that simple. Construction and construction sites, private and commercial. This one blew my mind. Why? Because construction is a chain of services you need. So people texting me and say, so does that mean a plumber and electrician can be working?
We've gotten those questions
And I say
too.
to them, let me tell you, let's be logical.
Yeah.
It's true the law doesn't say everything. But just an electrician and plumber working as they wish? No. But are they at a construction site? I have to say yes, because how will the construction continue when you need everybody? The electrician needs to be there to pull the pipes and all the wirings and so on, and the plumber needs to be there to put the PVC pipes, you know. So I would say plumbers and construction workers at the site of a construction.
That's why your legal insight is important, because I think that one of the things that with the classifications that are provided for, there are some gray areas. I've heard some stores say, well, you know, I think I classify as
they want to classify.
food, so I'll open, or, you know, what makes a restaurant
I want to address
versus
some
a
of
food
those.
vendors. So, I mean, there are little things
Especially
like
food
that.
vending.
Yeah.
I want to address those because I get a lot of questions.
Yeah.
So,
let's start with your primary ask questions, because people want to
Okay,
understand
so my
who
primary
can
ask
move
question,
today.
the port is open, the borders is open. Who can be there? I say to them,
The
the
port?
border is open and the port is open for trade.
Yes.
I had a custom worker contact me and say, I don't see my name listed, my category listed there. I said, look, it's not listed there, but it has to be included.
Because they
the
say
goods,
cargoes
the
are-
goods can't go a step further without the broker.
Customs,
So if the authorities come and shut you down, then there's a problem. But I say to people like that, I say, do your social distancing, do as much as you could from your home, and only go out when you really have to go out. So in that case, I suggested to a client of mine, draft a letter for me to approve, so that if they stop your employee, they have a letter that shows that they're employed by your brokerage form, and it has the company certificate to show that it's a legitimate thing. So it's little things like that I don't want people to bog down the authorities, and the poor commissioner have to be calling one call after the other, answering.
Yeah.
We have to find a way to get common sense out, right?
But there's also a discretionary power, with the police.
That was going to be my big question. I mean, I think as a general reaction I had to the act, and I suppose it's always something that I think about when you're reading new legislation, is the enforceability of it. And if you have a section that's talking about you're allowed to go out of your house talking for essential needs, where, if I'm not mistaken, essential needs is not defined in the act.
No.
How is it then that it's going to be something in the discretion of the police officer to stop you?
I think there's some discretion.
And if they say, and are they going to say, if they do stop you and you say, well, I'm leaving my house for X, Y, and Z, are they going to be able to say, that's not essential in my view?
Yeah.
Or
are they going to follow you to make sure that that's what
Exactly.
you're doing? Like,
Yeah.
officer, I had to go buy one pack of bread. You sure you to go buy a pack of bread?
Yeah,
Yes,
see.
officer, I'm pack of bread at the go. And they will follow you to see you buying a pack of bread.
That was my reaction. So I was wondering what were your thoughts were about,
Yes,
the
there is some
enforceability.
discretion. There is some discretion, and I hope the police officers use that discretion wisely. I would strongly suggest that you don't just lock up people. Give them a first warning. Talk to them. Some people really don't know what we know.
Yeah.
This hasn't been
That's right.
greatly publicized. I was shocked the amount of questions I've been getting.
Yeah.
So the next question I get, tacos vendors, street vendors, do we qualify as restaurants? The answer is no. Because the law specifically says establishments, and establishments is where you're in a private property, you have a trade license, you do all of that. Vendors have a
Peddler's
ambulatory permit and food handling stuff. So one lady is very smart, she asked me this morning, because people have been texting me and asking me, So I've been giving a lot of free advice, Gavin. I hope good karma comes to me, because my office is closed down. But
Because you are also, as an attorney, not an essential service. Yeah.
So the lady is very smart. She says, Miss, what if I make the tacos in my yard and I just make people come pick it up? I can't blame her. They can't stop you from
It's
doing
a
that.
delivery.
Another person
I'm a
said,
takeout.
my barbecue place up on the street side, whatever. And I said, Mom, that is not an essential service. It's food, yes, but it's a vending spot on the street. She said, well, I had to move my barbecue grill to my yard and I want to deliver from out there. You can't stop them then. The problem they may have is that city council may come and see whether you have a trade license to have that. So try and work out those legalities. But at the same time, City Council has been shut down because I don't see they put them here as essential services. This legislation specifically states, and I must read that, and I'm thinking it's just an oversight.
Well,
it's
I
an
mean,
oversight. I'm hoping and that they would fix it, but I gotta read what's here. Come on, Audrey, let me find it quick.
I'm sure there's no intention to cut down municipal bodies or to restrict municipal bodies.
No,
that perhaps
but
is an oversight.
you see, if you go by strict law, they can
Yeah.
say, here, look how at Schedule 2, they specifically say here that
they have a list.
National Assembly, yes, National Assembly, where is it? The Prime Minister Office, Attorney General Ministry, the Judiciary, Human Development, Agriculture, Public Service. I'm missing it, but it's somewhere here.
Yeah.
Oh yeah, it's under Schedule 1, Essential Services, number 4. Cabinet members and members of the National Assembly, they should have put there also municipal governments. So I'm thinking it's an oversight because I can't see anybody telling me, Wagner, he can't come look over the city.
Or in any of the
or
municipal,
Bernard, you can't look over your city. Or,
Yeah.
you know, all the different mayors. So it's an oversight, and I'm hope that there is an amendment, or if there's not an amendment, it's understood that these people from the municipal governance can operate, but then that takes you to the other question. To what extent should their offices be open?
Okay, but then it goes to the larger question, and that's where I wanted to actually eventually get the conversation. So I know it's kind of a reactionary thing. It's different, it's restrictive, but at the same time, we also had, as you said, many people clamoring for this.
Yes.
But we can't clamor for a state of emergency and then all of a sudden want to all be exempted to move around. And what we have to always keep at the forefront is why we're doing this and that it's temporary.
I like that you said we can't all be saying we want it and then some clamoring not to be exempted, be exempted, right? Because I'll be very honest with both of you, my gut reaction when I read this was that this is not fair. I can see where some huge businessmen lobbied to have their sector qualified as essential and necessary. And I know some people don't like when I say what is the obvious, and clearly I'm not to insult anyone, but right now we don't have an operating opposition, which I'm not bashing the opposition for joining forces with the government. I mean, they have to work together now. So there has to be other voices of reasoning saying, look, I know that you all are doing your collective thing, but this is not making sense. And what's not making sense is that when you read that, you could see clear that there were special interest groups that lobbied. And like we say, you know, money talks and you know what walks. I won't say it on the show because it's a family show.
Thank you.
And yes, I could understand your special interest. I honestly could understand business people. But let's go back to what's the premise. The premise is to limit the movement of people.
Yeah.
My view is, and I hope I'm proven wrong, my view is that the earlier we lock down, the shorter the period would be. The later we lock down, the longer the period would be.
Yeah.
Because the longer we lock down, the more there will be infestation and you have to try and control it. But if we contain it immediately, or as we are right now at the state where we are, it would be ideal. I honestly believe, and maybe I'm being very optimistic, that if we can contain these 3 cases, or if we find any other cases, the fact that we contain them, we can prevent the spread. The problem we are seeing in other countries in Europe and now in the USA is that the leadership did not want to lock down at the right time.
Yeah.
And by the time they decided a month or 2 months later to lock down, the spread was too much. So I say we were 2 weeks late, but it's better a little bit late than never. So I still applaud the government, and I'm hoping.
Well,
they're
we
gonna
definitely
tweak
aren't
it.
too late. We're not
not too late.
As we've seen, our curve hasn't started yet.
And
but-
I hope, you see, and even this thing, I was talking to different statisticians and people, and I read a lot of reports, and there's this belief that you must make the curve peak and you must go through that.
Yeah.
I believe contrary. I believe contrary.
But that's an epidemiological reality.
yeah,
and it's
theory
how,
for them. Theory for them. But
based on experiences with other viruses.
our
and
peak could be
outbreaks.
3 because
Well,
the peak is not the quantity in terms that it has to reach the double digits
Yeah.
and the triple digits. The peak is whatever your population is per capita. That's how I'm seeing it.
Yeah.
So this could be our peak. And who says that we have to do what everybody else is doing? Who says that we have to go through the same errors they go? We are seeing, and we could do better. I literally believe that we could have closed our borders, we could have revamped our internal economy for a while, so that if we had not allowed anyone to come out, to stay in quarantine and keep them there, this Easter, the local economy could have still been booming because everybody would have been traveling internally. But
But
we're
we
still
have
not
to
a
trust,
bad,
but we
we're
also
still
have
not
to
at the
trust
worst
the
place.
science. I mean, we have to trust the science because that's what we're guided by. It's why we talk about
Yes,
laws with lawyers.
And that's why the scientists, they're telling you themselves that, you know what, it's a phenomenon still. This is what we're saying based on other patterns, but this is a novel virus. Even right now, I'm seeing on the news last night that in China there's an outbreak in another area, which we thought would not have happened. And there have been instances, at least I read one report where there was a reoccurrence in the same person, but the scientists are saying, don't take it as gazette that it will reoccur. It could have been that the person was not fully healed, and so when we do the testing, it's not a relapse, you know, stuff like that. So it's new, we are learning, but I really still think we are at a better position than we would have been otherwise. I believe it can be contained, but I have to beg the general public, please do your part.
And that's what I was
Do your part. You may, and doing your part may be sharing the information with your neighbor. Because I know there are a lot of people who really don't know the information. The fact of my phone blows up all hour of the day and night and people asking basic questions, I answer it because I don't think any question is a stupid or silly question. It just shows that people, even sometimes when they read it, they're not sure, they're interpreting it, and they need that reassurance. I wish there would be a better way for us to get the dissemination of information, but for now we have to rely on you guys, that you have these discussions, that you yourself, you're informed, that you can tell people, and for people to know that if you really have a suggestion, there must be a way you can reach to someone and offer that suggestion as to some of the things we can change. If you have a gray area, I don't want to say call the poor commissioner because he will never do any work. There has to be somewhere
but
you
there
could
is
call.
a
Is there a hotline that you all
There
know?
is a national security hotline that you can call, and I know that's out there. I don't remember it off the top of my head. But I think one of the things that we can't lose sight of is our individual responsibility. And it's like hurricane planning and evacuation. You know, when we don't move to the point of mandatory evacuation, but every time you don't move when they say please move, you put other people's lives at risk. And that's kind of how
especially
I equate
the
this.
rescuers, because now these rescuers will have to go risk their lives to go save you.
Precisely, and that's kind of where we are. This is our evacuation notice, but this time it's a stay-at-home notice. And while it will be uncomfortable, and many people would want to move around, or I don't even know if they want to move around. I just think it's the thought that you can't, that you want to. But it's just temporary, and we just need to do it to get ourselves to a point. We had Dr. Figueroa earlier. He spoke of not fooling ourselves to think that we'll come out of this state of emergency with no cases. We will continue to see.
It's true.
But what it gives us is time, and it gives us critical time to be ready at the healthcare centers and to keep the transmission
and what it
as
gives
low
us
as
is
possible.
the opportunity to contain.
So maybe
and
we
if
do
people don't understand your movement, I want people to think about it like that. Think about my jacket being the virus, and everywhere I go, I take it. This jacket cannot go anywhere by itself. It needs human to move. So each time a human being moves, it moves it. And you have to remember there's two risks. There's the risk that you're a very sociable person and you're all over the place and you have it and you're asymptomatic, so you don't know how much you're spreading it. And there's also the risk that you may not have it, but every time you move, you come in contact with someone who can give you it. I was reading what's happening in Switzerland and Netherlands, which is they've done different. What they did, they isolated all their vulnerable people, the elderly, the sickly and so, and they allowed the healthy population to just continue life as normal, preparing their health system, knowing that those people, some will get sick, but they will be able to treat them, and calculating also based on the science, what is the likelihood of them dying. And so they took a different view because they're saying we want the herd immunity. That means it will come within our population, they will become hopefully resistant or immune, and we will continue our population. But why can't they do that? They can do that because if 25% of their population gets ill, not die, they have the health services. We're seeing what's happening in New York.
And they also have a different level of discipline too.
Yes. So they took a different approach, and that's why I'm saying Belize didn't have to wait to be blown out like the other countries. We took a different approach. I really think we are taking a different approach in that we locked down when we had only 3 cases, confirmed cases, not severe, none of them needing hospitalization.
No fatality.
No fatalities.
We've moved to mandatory quarantine, which is also, I think, a comforting fact, because we had a good faith practice in place that
And that's not towards nature or
was
culture, right,
perhaps
Gabby?
too high expectation of our people, which is unfortunate because I can't imagine anyone coming back from New York, especially seeing what's happening there and, you know, welcoming others into my home or
Yeah.
going to someone's
It's unconscionable.
home. It's so irresponsible.
Yeah, it's unconscionable.
And so that's where we're at the point where they're at mandatory quarantine. So it's a bit more positive. I don't know what's happening with illegal border crossings. I'm hoping that's under control because let's look at El Salvador. And I think we know that you could lock everything down. Now, you can imagine if we'd ever said Belizeans were not allowed to return home as El Salvador did. They still got a case. They're at 39 now. So it's not that you can completely
But you see what's happening
free
too with them
yourself of
is
getting
that,
the virus.
the social network that was supposed to provide relief is not reaching so many people. But their crisis is because of the overpopulation or the large population. We don't have to reach that state. So one of the other asked questions that I get is, how do we get the relief? And there's a list of the relief. Go to the covid.com site.
COVID19.bz, yeah.
But I want to tell people this. One, yes, there's relief. But don't expect it to just come overnight. It takes a process. And so I know it's difficult, but if you try and access it and you don't get it immediately, don't get agitated and upset. I really believe that our leaders are trying their best to make it accessible, but there's a little process. Two, when you go through the list, you will see if you qualify or you don't qualify. Some people may not qualify on the list, but in real life need it. Find a way to access either your area representative or someone or social department, or find a way to access someone. Don't make don't go and attack without trying first to go and get answers somewhere.
And there's an application form, and they say that it'll be reviewed on a case-by-case basis. So if you go to covid19.bz, you can download the application form, and even if maybe you don't fit exactly the criteria, I would still encourage you to apply.
I would say try. But the problem we're going to have is the third one, which is that not everybody has access to this electronic technology. And sometimes the people who need it most, the most vulnerable, some of the elderly, you know, those are the people who don't have access. So be sociable and try and help a neighbor without being stuck up in your house and not keeping your social distancing. It really comes down right now to us developing a culture quickly of responsibility, and we don't seem to just by nature have it. But I always think that circumstances force you to have to adapt and to have to make changes, and this is the time to do that. I honestly believe we could do it. If we could look collectively as a people as to what's happening in the rest of the world and realize that if they had taken certain steps, they wouldn't be there, but we get the chance to do it. Don't take it for granted. It can't be that you want to wait until we're into crisis mode, which brings me to the other issue that I wanted to address too, which is the frontline workers. I was seeing in New York, where now they have come up with a policy where priority goes to testing their frontline workers because too many doctors and nurses have become infected. I don't know if any doctor has died yet, but I read quite a few stories of nurses that have died as a result. And I saw the interview, I think Channel 7 did with a Belizean American nurse there, and they're talking about how the situation looks. For some people, it looks like a war zone. And it's mentally distressing on the frontline workers. We have to be considerate. Every time we expose ourselves and we potentially become one of the patients, we're just exposing these people. And many of us have friends and family and loved ones who are doctors and nurses, and we have to think about them. And not only doctors and nurses, the people who give the support at the hospital. So I really hope that we're going to be responsible. I know that it's hard to stay locked up. It's definitely hard for me. I'm not going to lie. I'm not going to pretend and make people feel that it's the easiest thing for me. It's difficult. So I'm glad you all invited me on the show. I had an excuse to come out this morning. I know it's difficult, but let's try and find creative ways to do this. Before I went and buy those little puzzles so that at home I could do a 1,000-piece puzzle. I mean, we gotta try. Things work for different people. I know what works for a lot of people is music. Neighbors, stop being so complaining. Leave your neighbors to play music, because I'm afraid that we will kill up each other if we don't do certain things. And so I'm just hoping that our attitude towards each other changes a bit, you know. We're still not living on top of each other like you see in Europe, where the apartment is one on top of the other. Look what those people did. every evening at a certain hour, they all came out and they sang and they did things to entertain each other. We have to develop some kind of spirit like that.
We've seen some online stuff start that's pretty catchy. We've been sharing some music that people have made, and there are a lot of DJs in Belize going live.
We didn't know we had so many DJs.
I didn't know that. But let's get back to the regulations, though, because I also wanted to be clear with people just how they can move, when you can move, what the requirements.
How do we get this out to them? You know, it's clear.
Yeah. So we're saying very clearly to what the regulations seem to be saying: 8 p.m. to 5 a.m. Unless
Nobody
you have
should be
a
out.
government-issued pass, not your work pass, not a letter from your employer. Once you have a government-issued pass, those are the only people allowed on the streets. No one else.
Except, because this is another asked question that I get. Ms. Arjun, what happens if my child gets sick middle of the night? I don't have a pass. Common sense people, go to the emergency room.
Yes.
You have a good reason, and I'm sure any reasonable police officer or BDF, whoever is doing the patrolling, cannot hold you back. On the contrary, they should quickly escort you.
And I think any parent would have run to the hospital anyway without even worrying about that
So if it's an emergency, or even if you are at home and a fight ensues and you have to run out for your life, because the problem, we do expect a lot of internal tensions at homes. That's why the court is still open, because we are going to deal with domestic violence issue and occupation order issues. Don't stay. And if you feel threat to your life and limb at home, that's an emergency. If you have to exit, exit. If you have to run to a neighbor, run. If you have to find a hospital or a police station, run. So don't stop and think, oh, this is what matters then. You can come out. So, yes.
But beyond that, no one. 8 to 5 a.m.
Yes, I agree with you.
Not even exercise. You wait till after 5 a.m. to do your exercise, because now we're told that you can go out and do your run or your jog. And even if you, because I read somebody said, all of a sudden everybody wants to exercise. That's not true. People do go out.
Yes, it's true.
And they go out early, but just go after 5 a.m. So that's the critical time that you know that you're not supposed to move.
This is what I want to say to those who want to go out and exercise, which is good. I'm not saying don't, but be very careful as to other people being around, because while the illness is not airborne, it has been proven by the scientists, because we want to give facts, that if you sneeze, if I have it and I'm coughing and sneezing, the droplets can stay suspended in the air up to 8 hours, and it can travel up to 10 feet. That's why it's not airborne. Airborne means it could have spread far more, right? I mean, the likelihood of that happening is very slim, but imagine if they say 1 in a million and you happen to be the 1 in a million. And then the other
That's why you want to keep your social distancing as well.
And then if you know you're one of the vulnerable people, and I call vulnerable people if you're pregnant, if you're nursing, if you are some pre-existing condition, and I say if you're 55 and over. I know some places say 60, but I think 55 for me, just to be safe, right? I soon reach that category, so maybe that's why I'm worried about that. No, a couple years more. But that is important. One of the things what I wanted to say, a lot of people call me and say, Ms. Andre, my workplace doesn't want to close down. They're trying to find a way to fit into that retailer, wholesaler part. It's so funny, some of the comments I get, you know. And this is what I'll say to all employers, whether you think you fit in the category or not. The first responsibility I think you have is to send home your vulnerable people. Send home all your pregnant people, your elderly people, and people with pre-existing conditions.
Yes.
Right?
Can I just take a pause there? We should applaud that there are businesses who've done that without any advice. From the onset, they send home anybody with diabetes, hypertension, elderly, go home and work from home. We prefer you safe than here with us. And I think that's a commendable thing for businesses to do right here in Belize.
And since I've touched on that, I mean, there's just so much I want to talk about, and I know we'll run out of time. One of the things I get a lot of call about is employment and what they can be paid or not be paid. So I want to make it clear, because somehow some people got confused about something I said, I'm told. And so I want to make it clear in the show. There's a section 32 of our Labor Act that says, if you go to work and your employer doesn't give you any work, they still have to pay you. Or if it was a work day and they didn't show up to open the store, but you were available for work, they have to pay you. There is an exception when they don't have to pay you. And that's when one of them is an act of God. An act of God is now a pandemic. There were employers who, before the state of emergency was called, had made decisions to send home employees and gave them pay and whatever. There's nothing wrong with that, because that state, in my interpretation of it, the minute the state of emergency was called, then we agreed that the pandemic has reached Belize, and it is what we call an act of God. Not because there's a pandemic out there, it means that automatically it's an act of God that affects us. It has to be that somehow some act was done to declare it or make it seem that that's what we accept as our norm. I'm telling people, the minute the state of emergency was called, it's official who can go to work or not. Before, it was discretionary whether you send someone home or not. If you send someone home on your own, you still had to pay them. That's my view. But now when you're sending them because there is a state of emergency, which...
Or because your business has been told to close.
Right, this is official now. The law kicks in automatically. The other thing I'm telling people is that...
So what does that mean? And let's just break this down to bare bones. If the previous regulations and the current state of emergency say I must close my business, do I or don't I have to pay my employees? And I'm not talking about a conscious thing. It's just that there's literally no revenue coming in.
By law, no, you don't have to pay your employees. Your employees can remain employed for 30 days without payment for those 30 days. Section 2 is the law that says that.
Because they were told to close down.
Because there is an act of God, which we call it like that. Don't make, for those very religious people, we're not saying God is punishing us. Yeah. There's what we call an act of God or force majeure. We call it too, where it's a force of nature beyond our control. And don't start arguing that it was created, the virus was created in a lab or so. Let's look at it for the legal understanding that we have.
That's unfortunate.
That happening, that section of the law kicks in. So no, employers don't have to pay you, and employees cannot demand payment. There's a state of emergency. If you had any doubt, you know the period when that operates, 30 days. That takes us to another step. Employers have asked me, so what if I just want to terminate them because I don't know how long this will take. It might be more than 30 days. The nature of my business is this, that, and the other. This is my answer. If you want to terminate them, it has to be under Section 45 of the Labor Act, which is a redundancy. It says one of the way you can declare your employees redundant is because there is an act of God, a force majeure. But if you do that, you have to contact the Labor Department, either the union if they have a union, the workers representative, or you have to call the Labor Department and say, I am going to get rid of these 5 people. There's a Section 37 that says you can fire anybody anytime with no reason. But let's be honest, this is the reason. And the reason we want it declared a redundancy is what there is case law that proves that if you get declared redundancy, you don't pay taxes on your benefits because your redundancy benefit is to pull you over until you could do better. But if they just fire you like that, then you have to pay taxes on that. And that little bit of extra goes a long way.
But see, and this is where there has been concerns with the unemployment benefits, because we had someone on the show who was talking about their attempts to hold on to their employees, and they were saying they sent them home, they're not paying them, they're just hoping until things can recover, they'll come back to work. So they're employed.
They're still employed.
But not receiving a salary.
Right.
And if
because
you are
Section
employed,
232
you
allows
don't
you that.
qualify for the unemployment benefit. So then the next question employers have, am I doing my employee a disservice by keeping them employed? And perhaps I should unemploy them, let them go due to redundancy, so they can then qualify for unemployment benefit.
Yeah.
It's a really tricky gray area.
Honestly, the way you're explaining it, strictly speaking, that's what it is. And that is why I believed, this is my honest belief, and I'm hoping the authorities will consider it. Under a state of emergency, your government, your authorities can suspend all your rights under the Constitution, can even suspend provisions of the law. And I thought that they would have made special regulations dealing with employment because of the circumstances. Because when we look at our labor law as it stands, it really has a lot of loophole. It's not clear. I think it could be better. I think these are special circumstances. I honestly believe that I would have expected that they would have done certain regulations to assist. But of course, it's new for them too, and they don't know all the complaints and the circumstances. So I'm hoping that they will soon will be able to do that, or would consider it if we have to go beyond 30 days. But as it stands, Marlene, the way you put it is the right way. If you're still employed, you cannot get unemployment benefit. But if you're still employed and you will hope to go back after the 30 days, but you're not getting any money, that is where the relief under the state of emergency comes. And then they may need to tweak that.
Yeah.
Because, for example, in my
Because someone
case-
was arguing with me that employers would be irresponsible if they don't let them go, but some people don't want to break their service.
It doesn't break your service to be employed for 30 days without a salary.
No,
You
I
should-
mean if they let them go
Oh, yes,
for the
yes.
purpose of only getting the unemployment benefit. If I have an employee with me, I know I'm going to want them again, and they've
Yes,
put in sufficient years. I don't want to break their service. And
yeah.
yes, they may still be covered by Social Security, but you look at severance and all the other things.
I've had to advise several employers, and I'll tell you one thing that I find so far with everyone I've spoken to who's an employer, the ones I've dealt with. I want to applaud them because everyone that has spoken to me and says, Ms. Audrey, I really don't want to fire my employees, and I know legally I don't have to pay them, but in all good conscience, I cannot send them home without money.
yeah.
What can I do? And my answer to that is, you can always contract. You can always make a contract that does not comply with that law, but you have to be careful with terms. For example, you can't say I'm going to give you a salary advance because a salary advance under the law cannot be more than 1/3 of your salary. But you can give them a vacation advance, a vacation for next year's vacation or the following year's vacation because you want to give them money. You can decide, look, I'm just going to give you a stipend, but know that that stipend, I'm not going to get it back. Or you can decide and say, you know what, you all take your vacation now, this is your vacation pay, and employees have to be willing to be open too, because what many employees don't know is that right now, your employer does not have to give you any money.
Yeah.
So stop holding your employers at ransom and be reasonable as well. And for those employers who don't want to be reasonable, I'm going to say, you also have a conscience. Work, if these are people that have served you for 10, 20 years, or even 2 years, 3 years, I mean, you can't be unconscionable.
Yeah.
You know, you have to give them something.
Well, if you can, that's the thing. If you've had no business for
And for those who
a
who
month,
can't-
and if you're a small business,
Yes.
especially.
I've dealt with small businesses that I hear that saying we really don't have the money and they fired people. I just want those businesses to know that even though you don't have money and you fired the people and they've been with you for a while, those people can bring a case against you. They can go to the Labor Department. Unfortunately, we've never appointed the Labor Tribunal, so that's a problem. You might end up at court and you would have to prove to the court why you didn't go to the Labor Tribunal because it doesn't exist. I think the Labor Department right now is flooded with questions.
Yeah.
I got every number you could call at the Labor Department, and for 2 days I called it and nobody answered me. That's a fact, and I don't care who gets mad. I can show my phone records. I could call name and numbers. And then I finally called yesterday and I got to speak with Mr. Calvert Barber, but he tells me that he's on retirement since the 1st of February, but most graciously, he answered my questions and we had back and forth how he sees certain things and how I see certain things. But I needed to do that as an attorney because like some people were asking me some questions, especially for hourly workers, and I was telling them on my live feed that I did not feel I know enough that I would check with people. So I've been calling unions and different places just to see how they're dealing with certain things. And I think what will keep the economy going is this confidence employers have that they will get back on their feet, and confidence employees have that they will be assisted. And
they'll
so
get their
while we are
jobs
looking
back.
about all the safety things, I'm going to ask the authorities, make special provisions, boost up your Labor Department, do whatever you have to do, reach out to the unions, do something so that these employment issues can be addressed. People do not need the extra stress. Stress makes your immunity go down.
Well, it's
And
not
a lot of
only that,
unanswered questions
it's
right
a
now.
dual crisis, and I think we here who are working perhaps feel more secure in just focusing on health, but we cannot neglect the population that is at home with no income or half their income or quarter of their income,
Well,
and trying to figure out how am I going to feed my
Let
kids.
me tell you, if I may suggest this. I'll suggest what I've done, and you don't have to do what I've done. I have adopted the persons that I will assist with food that I know need it. You know, it's people I already know. It's people that have come maybe around my place as casual workers. I already told them, you could come by my place anytime for food and I will help you what I have. My view is no matter how it gets, I will share until all of us don't have. That's my view. I'm not saying everybody have to do that, but I know there are some of us who have a little bit more. Please find out in your neighborhood. help someone, because yes, while we want the government to do its share, the truth is the government in many ways is overwhelmed. This is new to them. And we've never had a strong social services, which now we need. We've always had weak systems in our government for political reasons, I would outright say. And now the government is forced to do a lot of social service, and we have to give them time to try
and also beef
and
up
put
the
systems in
healthcare
place.
system with very expensive equipment at
And
the same
I
time.
must applaud them on that, because that was one of the scary things. And I said to myself, imagine it took a virus for them to put basic things we need, because we neglected our healthcare system, but at least we have those things in now, you know.
Okay, let's get back to the state of emergency though before we quickly run out
That's
of
all
time.
part of the state
producer
of
is here.
emergency, because people need to feel that sense of confidence, and people need to know that there are places to go for answer, and the employment issue is ravaging in the minds of people.
I think we'll have to get you back and we tackle this one directly.
Yes, I would love to
wanted
deal with the employment issue on its own,
Yeah,
but I wanted to mention some of it,
Yeah.
and I want people to know that I'm doing my research too. I don't know everything, but you know, lawyers, we don't need to know everything. We just need to know where to go find it.
So we're promising you that we're going to, if you have employment questions, we're going to tackle that one at another time. What I want to be clear on is if somebody right now says, I forgot to buy milk, you know, for the baby. Just let's talk about, so 8 p.m. tonight to 5 a.m. Don't
go buy for milk.
Don't move unless you absolutely have to. And you know the difference between absolutely have to and not. This is life and death, and this is just collectively what we're all aiming to do. 5 a.m. to 8 p.m. There is some movement allowed. That's why your hardware, your supermarket, your vet, your clinics, all of these places are open. We can go out, but
your bakeries, your fishers, your agriculture and aquaculture farms, construction workers, port operation and waste disposal and sanitation.
Okay, so if I'm going to go out, there's no specific rule set as to what I have to show to prove, but I can be stopped and asked, and I will be expected to explain why I'm out.
Yes. Well, yesterday I called the Commissioner of Police, because when I'm not sure things, I called the authorities and I called him. And I said to him the circumstances for some of my clients that I was thinking about. One of the things he said is that at this point they're encouraging employers of these people that must be out at that hour to at least send a letter to your nearest police station with the names. Because at some point they want to be able to issue some kind of ID pass or something. But of course this is all new. So he's hoping that his police officers will exercise good discretion. And at the same time, if you're not sure, just write a letter, employer, send it to the nearest police station. If they
give the employee a copy.
And give the employee a copy. And if they're harassing them and they take them to the police station, they could always go to the record and see, oh, see, Marlene is there, channel 5.
But we are wearing our IDs as we move around as one step.
We don't have IDs for the court, no, Gavin.
No.
We just have to take it for granted that we are not lying.
Or
that
walk
we are
around in our robes, no?
I like that one. So, yes, that is the other time.
Or a letter from your employee. I know in Florida, some places they give you a marker for your car that you work there. Just to alleviate the process.
All of that
but
we have to develop
That's
yet.
if you work in one of the areas that you're allowed to move around, that your business is going to be open, that you're carrying out your work duties. But what if I'm not? I'm a teacher and I still need to run an errand. I need to go do something. Buy my groceries, go to the ATM. How do I know when I can go and what I should be expected to be subjected to?
According to the regulations, that category of person can go out anytime between 8 a.m. to 7 p.m. It says it right here, and it says that's when you can access your pharmacies, A. B, convenience stores. I mean, that's very big. They shouldn't even have said convenience stores, because Jusco wants to stay open now. They say they allow convenience.
What's the classification for convenience versus grocery?
Well, I think it has more than groceries. You have maybe a little beauty care stuff, and so it's just. I always think about a convenience store. It's like a little mini department store in that I can go and find
a little bit of everything.
Yeah, a little bit of everything, right? So they're actually allowing that, my personal opinion is that shouldn't have been allowed. It should have been supermarkets, but it says stores, food stores, supermarkets, meat shops, butchers, distributors, and factories of carbonated and other beverages, including spirits and food. I have a major problem with this. So let me break it down. I don't think convenience stores should be there. It should be specifically supermarkets. You could get food. At some supermarkets, you get some of these little conveniences,
Yes.
but it should be supermarkets and anything to do with food, like the butcher shops and stuff like that. I think so. I don't see how.
Does it say markets?
It says supermarkets. Markets is another category. I'll read that one. I don't see how, though, carbonated drinks are included, including spirits. Why? We just had the gentleman from the National Drug Abuse Council. I'm telling you that spirits, and by the way, people, spirits don't mean ghosts, right? It means alcoholic beverages. You should not be encouraging that.
And bars are closed.
And bars are closed, and casinos are closed. So the same way casinos should have been closed, Bolitas should have been closed. The same way bars and all those things are closed. It's closed for two reasons: for the social gathering, and because it has been proven, and the good gentleman was here, and all the doctors you all have spoken to are here, they're telling you drinking is the last thing you want to do. So the last thing you want to put in a legislation is allowing drinking. I mean, I saw an interview where the guy said he's Sutherland and well, he drink
rum will kill it. Yeah.
That is not good. That we need to dispel those myths because it only weakens your
But could it be
immune
an exportation issue that maybe it's to be exported?
Then if it's that, you need to be specific, because here it's telling you the places you can access between 8 a.m. and 7 p.m., which you can access, not those that can remain open to do some kind of exploitation. So that's too wide. And carbonated drinks, I'm sorry, I don't think it's the most healthy thing, and it's not an essential service. And this is where I believe that the huge businessmen bargain so that their business can continue. If Boeing, and I'll call them out because they're the one with carbonated drinks in this country, and they can't do me anything, sorry. You should be closed. You should be providing water. Water is an essential.
I was going to say they have water production.
I think you have to have a conscience, because the more you expose your employees with all those other things, you have to think about your truck with all your employees. Is the potential virus going around, or every stop they make is the potential virus attaching to them? I think that at this point, they shouldn't be doing deliveries all over the place. They should have agreements with every supermarket so that when I go to the supermarket, that's where I can get almost everything I want, water included. So I honestly believe, calling them out outright, that this is one of those sections that I see there had to be some negotiation to be included, and especially the spirits part too. That's so wrong. Why would we have beers right now and alcohol and all of that? You know, Travelers has done us a good service. They didn't go and make more rum. They made hand sanitizers using their products, and we need to applaud them and call them out for the good they've done. And to the general public, please limit your consumption of alcohol. We don't know how bad it would get, and I'm hoping for the best, but let's be prepared. So I have a problem with that one. Financial institutions, right? I do think that financial institutions need to be open, but they can do a lot of from home work. A lot of their paperwork has to be from home. I'm asking those financial institutions, remember the 10 persons that should be able to be there in part of the quarantine legislation. I had a problem with the quarantine legislation because in one section it says only 10 persons, and it names the businesses that were closed, and in another section other businesses that can be open at their own discretion determine how many people can be there. This is where I'm seeing conflict in the law, and this is where you don't want to give the public that mixed signal. So financial institutions.
So this is the list of places that you can go between 8 a.m. and 7 p.m.
But just no people, no bank will be open till 7 p.m.
Yes.
You know, they're just putting
They've
it in that
already
category.
issued different hours that they'll be working with.
And why I think that the financial institutions must be open, I would hope that the management would be conscionable and decide, okay, we don't want people in and out. So let's boost up our ATM service, let's boost up our online service, let's get customers, let's help them hook up online. We know some people don't have online service.
I was going to say, some people are very against online.
But you have to reach out to them. Why I want to highlight this one too, because it has credit unions, and I saw HRCU credit union line outrageously long. I know that's where a lot of the more low-income people access their money. It's needed, but I'm going to ask that they figure out a different process. They have to put an announcement or something to figure out a way to help without that.
Well,
that
it doesn't say
people.
when you can go. That's what I find interesting with the legislation. In other countries, they've done different things. So some of them it's been based on your license plate, like even an odd number. Some places it's been based on the even and odd with your social security card or your last name.
Or your voter's ID.
The letter of your last name. In other words, Monday, Tuesday, and Wednesday, Monday, Wednesday, Friday, the first half of the alphabet can go out. So A to whatever letter that is.
Yeah, we have to start thinking creatively like
and
that.
it kind of helps in terms of not having overcrowding in any area.
On financial institution, one of the big asks that I keep getting on my phone is, will Western Union and MoneyGram be open? The answer is yes. It says specifically here, money transfer institutions and pawn shops. Okay, let's stick a little pin here simply because the truth is, a lot of our people will be getting money from abroad. And we need to be able to allow them to get that.
Yeah.
The problem I'm seeing that is like, for example, Korea Electronics offers that service, but the rest of the store can't be open. So how do you deal with that? So I would suggest that the headquarter of MoneyGram and the headquarter of Western Union meet with their agents or find out where all their agents are and post which places will be open. Because Korea Electronic would be in violation if they open their entire store because they're not a supermarket, but they wouldn't be in violation if they open that section that deals with money. And it may be that your agent, your headquarters might say, you know what, if you do not fall under one of the other categories, you'll be closed, but we will announce the ones that will be open, or we the headquarters, can be the one dealing with all the money transaction. I'm not telling them how to do it. I'm just telling them think what you can do. For example, I know at 88 Shopping Center, I think there's a Western Union, so they managed to meet 2 criteria. And the government can't go on in detail pick and tell everybody how to do. You have to have some common sense and figure out what you can or can't do. So that's this course that has to be happening with those people. But for all those people who keep texting me, can I go to Western Union? Yes. Now the problem is, it's not listed as an essential thing you can go out for. And this is where the
But would
law...
it be the same thing I mean, because I won't say I'm going to go get money.
Yeah. So no, but my point is, it doesn't list it.
Okay. Okay.
I'm not saying don't go.
Yeah.
I am going to say to the police officer, if the person is saying, sir, I have to go get money, you can't pull it out and say, mom, it's not listed right here, no, right there, sir, for necessities, whatever. Nothing's the money.
Yeah.
Don't do that, officers. Have common
There's
sense.
a lot of discretionary power.
Because
I've been saying that since yesterday.
you can't be saying that these places can be open, but when you list it right here, what is determined as a reason to be out, one of the reasons to be out was not one of the things that correspond with a place that is open.
But
you can't say, sir, I'm going out because I'm going to go get a carbonated drink and spirits, and they'll say, but that wasn't listed as an essential service, and you say, but officer, they have it open.
Go and say, I'm going to go and buy some beers?
Right, because you left it open. You see why I'm seeing the contradiction, and a lot of our common sense people will
But that's the thing, and I think that's why, as much as we say these things, we must always say it with the caveat that we are not to be moving. It's like if you're going to go out, do one swoop of everything and stay in your house after that. This is not an opportunity to find your outing every day or something along those lines, because then we're defeating the purpose for what this is established.
Listen to this one that goes contrary to what the purpose you just mentioned. How can you tell me that hotels, villas, and other rental accommodations are open? Hotel, villas, it doesn't make sense. It does not come under an essential
Well, the
service.
hotels I know are being used for mandatory quarantine.
Well, then you don't have to put that there because it's government control. Once it's quarantine, government under the power of the state of emergency has to have some control over it, because it means that then they have to monitor who is there or not. And then it means that if that's your quarantine center, that's the last place you want anyone needing accommodation that is not infected to go. So it's not making sense to me. And I'm not trying to be overcritical. I just want them to think it through and make tweaks where they need to. They don't have to know everything. Us, the public, should have a voice and say, you know, authorities X, Y, and Z, and let them think it out. It's just giving them ideas. Then it says here markets, agricultural produce, fish, and meat. That's an essential, I believe. And if I could suggest to that's why I want to hear that our municipalities are essential service. If I can suggest to the mayor that one of the things we can do, since we need social distancing, go to the market, at least for Belize City. I'm not saying all the other markets because I don't. Go to the market. We have 2 streets wide. Go and set up within, and you tell them, look, these are going to be your opening hours. The public, this is the opening hours. This is how we'll come there. And create stalls all along. From you hit Pongyard Bridge, all along have those people out there. So you can do a drive-through or walk-through. That's mean. Nobody has to be coming out and having contact. And it must be that every vendor has something to wipe their hands or give you to wipe their
And
hands
also
there and
proper
then.
spacing. I know the CEO
This
of
spacing.
agriculture said yesterday that they would shift how the market is set up. Markets are set up because
And
they
they
will
should.
be open.
They should.
It is an essential service because we need our fruits and
Yes.
vegetables now more than
And
ever.
we want our agricultural sector to be selling so that the industry doesn't
Yeah.
collapse, right?
Okay, so we gotta keep it moving. Just so, and I think one of the things I was reading, they're still asking about domestic work, convenience stores attached to
Domestic workers, I don't think that they are essential
laundromats.
services. They're not essential services. And
No, they're not.
laundromats
We had asked
either.
the commissioner yesterday.
And laundromats either. It's like people you have to understand. If you're locked in, you have to now become self-contained and figure out how I'll wash my clothes,
Yeah.
how I'll hang it out. I mean, I hate going to hang out clothes too, but you have to do it. That's the idea.
It's only for 1 month.
Remember, the whole concept is to limit your movement.
Yeah.
I mean, suddenly I find myself in my kitchen baking almost every day. I forgot I could bake. That's how bored we get, you know.
And you said it. You said it right. It is not permanent. It's just a short term.
Yes.
And we're going to be out of our comfort zones, and it will require us to take on additional
for-
things that we never used to before.
And
but
for
it's for the
that
greater
category
good.
you're talking about that can be out 8 a.m. to 7 p.m., we have service of takeout or drive-through facility only at restaurants, saloons, diners, and other similar establishments. Those are for the people who have been asking me about
Yeah.
street vending.
But it says-
other similar establishments need to be read along with what is a restaurant, a diner,
Yeah.
a saloon. You know, you have to be, it doesn't mean a street side vending. So if you could creatively come up with your backyard diner, remember people can't come and sit there either. It's takeout. But if you can create a takeout service, now what I'm worried about takeout or delivery service is that then
Does it
means-
say delivery or only takeout and pick
No,
up?
it says right here, service of takeout or drive-through facility at restaurants, salons, diners, and similar establishments. But remember, it also incorporated the quarantine legislation that says delivery. So if you know you have your delivery guys, please make sure you get the ID or letter, whatever, so the police know this is my delivery guy.
Yeah.
And he's out taking food. And I'm encouraging you, let your delivery guy dress properly, have the sanitation products. When they deliver stuff to you, remember, the virus stays on plastic for, I think they said 12 hours. I've seen some say 8 hours, some say 3 hours. It doesn't matter. If it stays with it only 1 hour, take those plastics, throw it away, wipe your hand, do whatever. I mean, you can't sanitize everything, but you can take measures, do that.
Yeah.
You know, so that's good. Then the international delivery service, FedEx and DHL and all of that, they said only strictly to medical supplies and equipment.
Yeah.
So I don't think their offices need to be open. Those are direct contacts that you know the ministry will be calling you,
Yeah.
and that's what you use. That's my suggestion. Domestic delivery services related strictly to meals, groceries, medical supplies, and equipment. That's your delivery people. Mechanic shops, garages, and auto parts stores. I just think that should not have fit there. I'm sorry. Because if you're not moving around and all of that, you don't even have the need for that. I think that's a category that should not have. But if things get worse, that's one of the group that will have to
But this
close
is
down.
where we're starting from. So
Yes.
moving forward, I think they're
Hardware stores. Please make answer hardware stores. Suddenly, everybody became a hardware store.
well, I think what the everywhere is a hardware store.
So everybody want fit. I laugh when people call him, but Miss Audrey, we sell nails. I said, but is that what you essentially sell? You sell other things. You're not a hardware store. But because we said
I didn't think of it
construction,
that way.
if we said construction is going on, we need the hardware. So my suggestion into the hardware people, you're exposing your employees again. I know it says you could be open till 7 p.m. My suggestion, open if construction people know what they need. Open from 9 to midday, and if those construction people don't get that stuff that day from 9 to midday, tomorrow you come for the rest. We have to discipline ourselves.
Yes.
It can't stay open all day. That's my suggestion. Yeah. But just remember, you as the owner of the establishment, you're exposing yourself to. And at some point, no matter how much money you make, when you're sick, the money means nothing. So think about, yes, that's the wide area they gave me, but this is how I can narrate. And you know who are your usual contractors who come in.
Yeah.
Contact them. Send out message, send out text. Limit.
All right. So we gotta round it off now. What are some of the important points? So we got 30 days. We hear two things. One, it could be extended, or it actually could be shortened.
Yes.
Yeah.
Um,
And where do those powers come from?
Well, under the Constitution, the Governor General, in this case, rightfully declared a state of emergency. Under a state of emergency, the government can make any rules. This is the rules they've made. Yeah. They can tighten these rules, they can loosen these rules. The extreme would be where everything else stops, except food, specific food places that they will classify for each area, and pharmacy. That's the extreme. Yeah. We're not at the extreme, we're at very lax end, because the mere fact that hardware stores can be open and carbonated drinks and spirit drinks can be circulating, that tells you we are very lax. I still say it's a good start. Let's see how things go, and if they need to tighten it, people be prepared that it's tightening. Yeah. One businessman told me, says, you know what's not fair? I closed down my business over 2 weeks ago because I saw the risk, and now I knew that I wasn't an essential service. I sell clothes and stuff like that. I did that. Now there is a state of emergency, so I have to add to those 2 weeks, 30 days. I'm doing my part. I'm trying to still pay my employees and everything. It's unfair that I took that sacrifice, and then other businesses, such as the drinks people and the hardwares that are really not essential, because of their greed, they want to stay in, and they stay 30 days. So they're just taking the risk 30 days, and they're causing more circulation. If there more circulation creates a crisis and we have to add another 30 days, it's not fair that because of them, my 2 weeks, which has expanded to 30 days, will be longer, because they managed to make some money during that time, but that circulation created a longer period. I could see what they're saying. I won't pass any judgment. I'll simply say, not because it says that you can open, just open. Think what was the premise. The premise is to limit contact, limit movement.
And what are the risks involved for your employees?
And your employees. I know places where the employees go tell the boss outright, sir, mom, I will take it without pay. I have an elderly person at home. They need me, and this is how we're going to manage.
Well, that's what I was gonna say, that we're gonna touch the labor issues on another date.
Yes.
We skimmed through the state of emergency, Audrey,
yeah,
but
because we are halfway
out of time.
I know we're out of time.
But there's a lot more time to talk about
it's
this.
Just Stephanie didn't think that that I could have explained so much more, you know. So
we got a month worth of information, and I think that we haven't touched penalties as yet, but we're going to get to that one at a different date. Thank you for coming in and at least doing the preliminary information with us.
You're welcome.
We do appreciate it. Now it is time, parents. You've been watching, trying to understand the regulations. It's time to bring the kids in front of the television, because it's time for Kids Time. And of course, this segment is courtesy of J&W Shopping Mart. We have this special segment, especially for the children. And Dr. Panda is back today, kids. And Dr. Panda is going to be explaining to us what is a virus.
Toto, last time we learned all about the novel coronavirus. We also learned that we should wash our hands and wear a mask to prevent infections. But do you know why viruses make us sick?
No.
This time, we learn more about viruses and what they really want from us.
Okay.
If we want to know what the goal of the virus is, we first need to learn about our own body. The human body is made up of many, many cells.
Cells?
Yes. Imagine that we have a big puzzle. It is actually made up of small puzzle pieces. Our bodies are just like that big puzzle. And cells are the little puzzle pieces that make up our body.
Where are the cells?
We can't see the cells because they are really, really tiny. We need to use a microscope to be able to see them. Our cells are like a candy factory. Just like how the candy factory will make all kinds of delicious candy. Throughout our life, cells provide materials and energy for us humans. In the cell factory, there is an office called the nucleus. And in the office, you'll find the boss of the factory, DNA. DNA is very busy. He can't leave the office whenever he wants to. So he has an assistant running errands. The name of the assistant is RNA. And his job is to convey DNA's instructions to all factory staff.
The factory boss, DNA assistant RNA.
That's right! On the other hand, there is an evil RNA that lives in the novel coronavirus.
Evil?
Yes, this evil RNA also wants to have its own factory. But that factory doesn't produce energy. It produces a virus army instead. But the virus doesn't own a factory, so it tries to invade other people's cells to steal their factory. One day, the virus snuck into a saliva droplet and successfully entered a human body. But not everything can enter human cells. You need a key to do that.
The virus can't get in. Ha ha!
Toto, don't underestimate the novel coronavirus. It's very sneaky. Kids, do you remember what the novel coronavirus looks like? A, like a plant. B, like a hat. C, like a crown. D, like a tadpole.
A crown.
Yes! We know the novel coronavirus is round and has a lot of spikes on its surface, so it looks like a crown. These spikes are important because they can turn into keys to open the locks of the human cells. After they enter the cells, the novel coronavirus will reveal its real mission: to kidnap the factory boss DNA and take over human cells that are supposed to be providing energy to create many, many new viruses.
Oh no!
At the same time, the immune system army in the human body finds out about the invasion and rushes to the battlefield to destroy the cells occupied by the virus. When this happens, the human blood flows faster because the immune system army is rushing to the infected parts of the body via blood. That's why people will cough and have a fever. The novel coronavirus prefers staying in human lungs, so the war between the immune system army and the virus can also cause pneumonia. In reality, humans have faced attacks from many viruses other than the coronavirus. For example, smallpox is one of the oldest and most deadly infectious diseases. People infected by smallpox will have sores all over their body, and it will also leave scars on their faces. Luckily, no one in the world can be infected by smallpox anymore. 200 years ago, a British scientist, Edward Jenner, invented the smallpox vaccine and successfully destroyed this virus.
Awesome!
So, when facing diseases, we need to have trust in science. We are confident that doctors will soon find a cure.
Hi, Michael Tias here from JMW Shopping Mart, inviting you to try out our new online shopping sensation, jmwshopping.com. Our online versions allow you to shop from the convenience of your cell phone. Our online store allows you to shop for all your groceries, frozen products, beauty supplies, pet supplies, kitchen supplies, wines, and so much more. We at JMW Shopping Mart have made shopping easier for you. Visit us at jnwshopping.com.
All right, and there you had it. That was our kids' time, and that was courtesy of JNW Shopping Mart, where you can do online shopping for all your supermarket needs. So if you want to stay safe and stay home, that's one of the ways you can do it. Of course, you can look forward to seeing this segment every day at the close of our show. JNW is sponsored, so the parents can get a little break. We know the kids are at home, and you can be able to put them in front of the television and have them learn something important.
Yeah, for sure. So we hope you enjoyed that. Again, that was brought to you by our friends at JNW Shopping Mart. And we hope that if you did watch along with the kids, you did learn a little bit more about viruses.
All right, well, we're going to go ahead and take a break. And when we come back, we're going to wrap up the show.
With over 100 years of service excellence in Belize, the Belize Bank Limited recognizes the importance of leading the way as we enter into this fast-growing technological
And we're back.
You know, today's show was pretty fun and really informative again.
Yeah.
I mean, of course, what's on everybody's mind is COVID and how we're going to be coping with the response.
Yeah.
From several different angles,
Yeah.
as you know, and that's kind of what we discussed this morning. We saw it from the medical standpoint, from the community sort of health management standpoint, and also from a legal standpoint as well.
Absolutely. Okay, so we know that there's a lot more that we have to cover with the regulations for the state of emergency, and we do commit to do so because we want to be as clear as possible for people to understand what your parameters are during this time. Today is day one of the state of emergency. I guess on a personal note, I just want to kind of remind us all, and we all need a reminder. Being restricted is scary. Like naturally, even I feel it, and I can come out for work where I'm like, but what if I want to go here? What if I want to go there? Will I not be able to? And I don't even need to go anywhere else but work right now, but it's the thought of it. And it really can weigh on you. So while we're all feeling like we have to find that loophole that allows us to do something, just remember why we're doing it in the first place. You know, it's a little bit of discomfort. It's like our medicine. You know, sometimes you got to take really bad tasting medicine because you want to feel better. That's what we're doing collectively. We got to take a bit of discomfort so that we can be able to minimize the spread of this virus. We have all the cases outside of the country to be able to see how bad it can get. And I think I can safely say we all don't want to get there. So let's just do this part for now. We're talking about 30 days. Day by day, we're gonna be here with you. And you just have to just see the end rather than focus on what you won't be able to do. Just know that it will come with an end. And this is a part of making it a more manageable situation.
No, absolutely. I completely agree with that. And I think that we all have to recognize that we all have an individual part to play in this.
Yeah.
And at the end of the day, it's taking others into consideration as well. It's taking those who are at risk of developing serious complications, taking into consideration the health and the well-being of our first responders, the healthcare workers, the essential service providers who are all at a greater risk than us because they have to be out and about, they have to be in the community, and especially in the case of healthcare workers, they have to be dealing with it, they have to be dealing with this issue head on. So as this epidemic continues to develop around the world and we develop new strategies, stay informed, keep updated so that you are in the best position to protect yourself, the ones around you, and of course, everybody else in the community.
All right. And we also want to tell you, you know, you're at home, you're with the kids, you have a lot of time on your hands. Be creative. We've actually been sharing some videos over the past few days. We started off with a video with Dr. Pinedos, who is in self-isolation, who wrote his own COVID-19 song. Yesterday, we shared a piece by Frankie Reno, who was kind of just, I guess, playing around on his piano. Today, we're actually going to close with a special COVID-19 song from Super Furia Band. But we definitely encourage you to share your videos, your songs, anything that you're doing to kind of just have some fun while you are at home in the state of emergency, and we'll include it as a part of the show. In the meantime, if you want to contact us, send us an email at oye@channel5belize.com. Drop me a line at marlene_oye@channel5belize.com. Find us on Facebook at Open Your Eyes BZ.
And you can also find us on Instagram at OIE Belize.
And remember to tune in tomorrow morning at 6:30 when you open your eyes.
Start your morning right.
Until then, keep your eyes, your mind,
and your heart open. And wash your hands.
Yeah, that's right. Keep those hands clean and stay home. We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.